through airway bill number 071-3701-986. This consignment arrived on the 20th of May, was discharged, was released on 24th of May, again through to the Ministry of Health, through the designated officer, Dr. Isabella Ayaga. Thank you, Madam Chair.
Thank you very much, CS, and I hope the detailed report can be handed over to the members of the committee, because you seem to have information that you've read that is not on this summarized document and would wish to have. My only question, and maybe that it's in your other document. I've seen the COVID-19 detection kits, medical supplies, laboratory supplies, kits, screening, hospital care. Where are the PPEs? When did the PPEs arrive? Are they part of this, or would we be able to know the air bill number specifically? Because I can see detection kits are very clear, so would like to track the PPEs. And maybe it's in your other reports. I'm not so sure whether you're able to tell us where, which one. CS?
Yes, Madam Chair, we are able to track this through the Ministry of Health, who are the recipients, on behalf of KEMRI and on behalf of the ministry itself.
Yeah, so my question is, you see, you have given us clearly the date of arrival, date of release. So which one is it? Which batch or which air bill number is it?
Yeah.
Which air bill number is it? You know, we can see their detection kits. It's clear. So my assumption is it's number 3, but I don't want to assume. So I'd like we clearly know the PPEs. It's okay. Your people can be checking as I take a round of questions from members. Honorable Chagagwa, Honorable Ovino, Honorable Joyce, and then Honorable Koros, Honorable Adagala. I think in that order.
Thank you very much, Madam Chair. The question was the CS to respond to questions on Jack Ma Foundation COVID supplies donation. My opinion is that the answer given is quite fake. At best, I would term it an escapist and not to the point. Honorable Obure, Chris, has very succinctly summarized what they did, summarized on this table, Madam Chair. But other than telling us that there was a airway bill number this, 071, blah, blah, description of the goods, COVID-19 detection kits, the date of arrival, 24th, the date they were released, 24th of March 2020, the flight that they came with, Ethiopia Airways, the 318, and they were handed over to KEMRI. What were the quantities of these consignments? Because we're not just we were not here to investigate just a paper trail of the flight that it came with. What were the specific quantities of these items that were delivered or donated by Jack Ma to the great people of the Republic of Kenya? So other than giving us that narrative, we actually don't know whether the detection kits were fired. The CS, Honorable Bure, to give us particular details If it is a medical supplies, what were actually the medical supplies? What were they? That is a loose term. Thank you, Madam Chair. And especially for all the other 5 items, I would wish, Lala, that you could clarify and give us the specifics, the specifications of the items that was applied to the government of Kenya or that were donated to the government of Kenya. Thank you.
Thank you, Honorable.
Thank you, Chair. Just to corroborate what Honorable Jagoga is saying, as a government clearing agency, what this committee is interested to know is the accountability of those goods. And I was kind of surprised, Chair, if you say you want to know from the entity side what was given. And you can give us detail of even the vehicle which picked it up. So globally, the operations of a clearing agency must have that form which has a detail of what is dispatching to the other entity. So without that, then this kind of information you have given us is not really of some importance. So, Chair, I really want to reinforce what Honorable Jagawa is saying. We need those details so that we can also verify with the list that we have for JACMA commodities. Thank you, Chair.
And maybe as we respond, Kemri, I've seen Kemri's here. You might be able to tell us what you also received. I've seen there are 3 items that Kemri received. I don't know whether you also came up with details of what you received.
Yes.
It's a fee, maybe what was received at the airport. Honorable Joyce.
Thank you, Chair. Looks like our questions are related on accountability. But I want to say the information we'll be getting here is really very important because Kenyans are very anxious given the stories that went round that JACMA's donations disappeared, the allegations of loss and theft, the allegations that some of the consignments went out of Kenya. So this is very important. And as a matter of just confirmation, would the CAS then, after giving us the information is given, confirm if all the consignments really arrived, if all of them, as had been indicated in the documents, were dispatched, and if the first question on whether the organizations that took them can be accountable, and if these are all, except of course the ones he read that are not captured here. Thank you.
Thank you, Honorable Cross.
Thank you, Chair. First and foremost, Chair, I think what we have received from the, is it CS or CS? Sorry, I came late.
That is, for the record, this is the Chief Administrative Officer, which is CAS, Ministry of Transport, Honorable Christopher Ombule.
Okay, thank you, Chair. Because what we have received from the CS is too shallow than what we were expecting. Because for sure we really wanted to know exactly what quantities did we receive from JACMA Foundation. Because all that what we are getting from here are just it's not showing clearly what we really receive from JACMA. Secondly, Chair, I'm seeing this government clearing agent. Who is this government clearing agent? Secondly, Chair, who are the directors of this clearing agent? And Chair, if these clearing agents aren't here, I request you, Chair, they should also come and face this committee to tell us what did they receive. Lastly, Chair, I hope we will also get clarification from Kenya Medical Research Institute, Ministry of Health, on the quantities of these goods they receive.
Thank you. I think you can respond.
Yes. Yes, Madam Chair. the quantities of the goods that we received and cleared. This is contained in the airway bill. And as I said during my response, the representative of the Ministry of Health verified these items and confirmed that they were consistent. What she received was consistent with what was dispatched through Ethiopian Airlines. For example, on the first consignment, the quantity of the detection kit that was received and cleared were 11,300 kits. On the second way bill number, with details I gave, the consignment was 274 packages of various items of medical supplies. When it was received, when it was dispatched, they discovered that there was an excess of 12 packages. These 12 packages were subsequently received through way bill 2668.
Point of order, Chair.
What is out of order?
Yes, Chair. That's the information we wanted. Why is he keeping for himself that information?
Did you have copies, CS, of the information?
Yes, I will make available copies of this information.
Okay.
Because,
and then, excuse me, Chair. I think we have one of our friend of the committee who is not supposed to be sitting here. Our senior is supposed to be sitting there, not here. Because I'm asking a question, he's responding for them.
Order. And
I'm requesting my senior honorable, my friend, I think you should be sitting there, not here.
No, Honorable Koros, let's, as colleagues, let's respect each other. That is our grandfather in this parliament, so let's respect our senior. And let's get to the sections, let's go on. Honorable Koros, that's your grandfather, so allow him to sit freely where you want to sit. And I ask the CS to proceed.
Yes.
And our senior, don't engage with the young ones again. You take your cool. Thank you.
Madam Chair, Honorable Kolos is honorable member. He is not a young one.
Honorable Kagwe, let's proceed. CS?
Yes.
Chair, can we get copies? I think that's what members really want.
Yes, that's what we heard before we got diverted. So, you said you have copies?
Yes, I will make available those copies.
Okay, I wish that once you go through them, you table them, give them to our clerk, so that we can go through them.
Madam Chair, the third consignment was in respect to disposable gloves, masks, and so on. This was in the form of 3 packages of 22, each weighing 22 kilograms. And this, as I said, was received on the 28th of May, 2020. The other consignment, Madam Chair, was in respect of assorted medical supplies, 697 packages. This was received and dispatched on the 24th of May, 2020. However, on this consignment, 21 packages were short-landed, 21 packages. And up to this moment, this has not been accounted for by Ethiopian Airlines. But the rest of the packages arrived safely. And I want to confirm, Madam Chair, that all these items arrived safely and they were dispatched following proper verification by the designated officer. And at this point, maybe I will request the director, first of all, the principal secretary, Solomon Kitongo, if he wishes to clarify any of these, following which, with your permission, I will request the director of the government clearing agency, maybe because these are the people who handled them on the ground, to say, with your permission.
Proceed, please.
Thank you, Chair. Chair, we came with the director for government clearing agency who actually dealt with the matter so that he could provide any further details.
So who is the director? Proceed. I think you've had the concern from members, and it's clear what information they want to get. So would you just be very clear on what you received, the process, and how you handed over, whether to Kenry directly or to the Ministry of Health? Did you hear me?
I didn't get that.
Yeah,
thank you,
proceed.
Madam Chair. Yeah. As you heard...
Order, Chair. Point of order, Chair.
What is it, Honorable Koros?
Can he first introduce himself, Madam Chair?
It's okay, he's just headed there. You know, not everybody is used to this, getting inside these chambers. That's why I had to ask him whether he heard me. So, Director, introduce yourself, what you do for government, and handle the issue.
Thank you, Madam Chair. My name is Felix Ateng, Director, Government Clearing Agency.
And
now
also, could you also properly wear your mask?
Yes, I'm Director, Government Clearing Agency.
Put up your mask so that it covers your nose. Thank you.
This is an organization that was formed with an objective of facilitating the government in clearing and forwarding of anything that it exports or exports. As clearly stated by the CS, these consignments arrived.
And speak to your microphone so that we don't struggle to hear what you're saying.
They arrived in 6 batches, and the first consignment, as was mentioned, arrived on 24th March, and there were detection kits, 11,300, and Ministry of Health designated an officer by the name Dr. Isabella Ayaga, who is the head of Global Health Security at the ministry. So she's the one who we were coordinating with when clearing these consignments. So the first consignment was received by an officer that she directed called Vitaly Shikulu from KEMSA, and was transported by KEMSA trucks on the same day. The second consignment...
I think, I don't know that I'm the only one who is lost. Director, we might need to give you some time.
Yeah.
Because that information you're giving us is what we are looking for.
Chair.
But clearly what you gave us...
Madam Chair, let me add my voice on this.
Order, just let me just...
Chair, would you allow me to add on my voice?
Honorable Koros,
thank you,
Chair. Hold on. Vice Chair.
Waziri, Chris, you have a lot of experience when it comes to Parliament. I guess so. And going with the document that you have tabled here, and even the document that you are reading there, is not the same. And then 2, the Director of Government Clearing has more information, which the ministry should have harmonized and tabled as a whole to the committee.
Honorable Koros, could you allow my colleague to finish, then I'll give you a chance.
Will I say
that you are not prepared enough to appear before the committee, and perhaps you need enough time to go and harmonize what you have, and perhaps being given more time to table that document here. I think that will sort out this issue.
Thank you, Vice Chair. I think that's what I was raising, because you seem to have information that we don't have. For example, you said the first bunch. You actually added it was 11,300 detention kits received by Dr. Ayaga, then who received a cancer. That's the information we're asking for. I don't know, you seem to have other papers that you're referring to down there, but what you can do is we give you time, you go compile those many papers that you have, give us as a report with attachments. So that it can, what you are saying is what we are looking for, but we are struggling to hear you, you are not very audible. And number two, that's information that we would want to have, but is not in our document.
Chair. Yes, Chair. That's why Chair was saying what Wasil was giving us was fake. I request, Chair, I request this committee. I think what the director is telling us is the truth. What the ministry is giving us is fake.
No,
and that's why when we have such kind of a national issue which Kenyans want to know the truth, it's always good when we have the CS himself answering these questions. So, Chair, I think it's good for us we listen to what the director is telling us, because that's the main guy who receives the consignment. He will tell us the truth, who receives, Silienda wapi, Silienda Kemri, Silienda Ministry, Silienda Tanzania, ama wapi. Let us listen.
I think I'll give it also to Honorable Dagala so that we conclude this matter.
Thank you, Chair. Thank you, Chair. I list the issue of the consignment that the table that the CS has given us is vague. You know, it's like they are hell-bent on losing us on a trail. The CS gives us a schedule. He calls his director to give us some information, which he is holding to himself. Our letter went out last week, so that they can come and tell us about the consignment of Jack Ma's donations. But if they're giving us information in piecemeal, I'd equally stand with what the chair said and other members. You can stand down that witness, stand down that ministry, they go prepare, give us one bundle of documents so that we are able to shift through the information they're giving us, then we're able to interrogate that information. But if you know he says there were 11,200 copies of this and this, by the time he's through, I may have forgotten what I want to pinpoint. But if I have a file like the one I'm having here, I'll be in a position to interrogate what they're telling us, and what the Professor here will tell us from Kemley, so that are they telling what they received, what was cleared by the government clearing agency, and what the CS has told us. We need one bundle of document for us to be able to interrogate. But if
I think we are all in agreement that the document before us from the ministry is not well prepared. And so I want to make a decision so that we move on.
Madam Chair.
Because we see the director, you have a lot of information that we require. We need to compare what you received, what Kemri will say they received or the ministry, and what actually got to the warehouse and what went out. Because this is a house of record. And we just need to have proper records. As we said, you can say something and you deny tomorrow, I didn't say it. So that's why we need written submission before this committee. So I can allow you, CS, to say something, but I'll allow you after that, you take leave, go prepare a proper document, and appear before this committee tomorrow at 9 a.m. We'll start earlier, but to start at 10, we can start 9 a.m. with you, so that we can have a proper document. CS.
Yes, I hear what you're saying, Madam Chair. But what were we asked to come and respond to? We were asked to come here and respond on the role played by the Minister of Transport in clearing the Jack Foundation supplies donation. We responded to that. The second one was, how and when did the Minister of Transport hand over the shipment of, to the Ministry of Health. We have explained that. Subsequently, supplementary questions have arisen as to the quantities. And we were in the process of providing these quantities, and I had promised that we will supply copies of these because it was not in the initial response, Madam
Point of
Chair.
information, Chair. Just a point of information.
Do you want to inform?
CAS.
Yes, do you want to be informed by Honorable from Diwa?
Yes.
Thank you.
Proceed.
Thank you, Grace. What this committee really wants is the detailed document. And actually, when you are called here, you are given an opportunity to exonerate the ministry on what is flying out there. So what we really want, including bill of quantities, and if possible, pro forma invoice, whether it's donation, they do have those from the shipment agents. In this case is ET, which is Ethiopian Airline. So why we are standing you down, even though you have responded, but in our view, that response will not get you off the hook of these things going around. So you need to get back, get the time, get the details, including those pro forma invoice attached to it, bring to us, and we will be over. That's what we are looking for, CES. Thank you, Chair.
We are concluding this matter. Honorable Chris Ogure,
Yes.
do you feel now you're informed?
Yes, I am properly informed, Madam Chair. And yes, it's a good idea. Let's provide all the information on one sheet. We'll be able to do that. And bring the information back by 10 o'clock tomorrow morning.
9. I can do it 9:30 because we have another committee. We have other people coming in at 10.
Fine.
We had scheduled you for this afternoon.
Okay,
But
fine.
even for your officers, because I know they are there.
Okay.
Director.
We will
of
do
clearing.
that. We'll do that by 9:30 tomorrow morning.
9:30.
Chair, before you close,
Yes,
could
Professor.
I have a word, please? Thank you very much, Chair. My name is Mahmoud Sheikh, Member for Parliament, Professor Mahmoud Sheikh, Member of Parliament for Wajir South, and a member of the Health Committee. Apologies that I was in another meeting. Now, my point is not about the CAS or anybody, or not about the director's position or anything else. It is about why the CS is not here. If this has been discussed, then I will need to get updated on. But why is the CAS here? If we can remember, the Health Committee
Professor,
has clearly put forward, and it has
Professor,
gone to the House and the
Professor.
Speaker. Yes.
Let me just inform you that we had already dispensed that matter. There's a letter already with us. And so it's only that you came in a little bit late. We had already
But
handled
tomorrow
that.
he must be here. It's another day. He must be here because the last time we discussed, even in this House, by the Speaker and the ruling that was given, we want to see the CAS coming, the CS coming here. Macharia, CS Macharia must be here. We are not going to condone issues of, and avoiding this important parliamentary committee that is equivalent under Article 125
Professor.
of the Constitution of Kenya puts this House as equivalent to a High Court. And it's not a joke. It's not a joke. Thank you, Chair.
Professor, I would also wish that order the Congress, you cannot order the chair. That's one thing. So
Point of order, Chair.
you cannot order the chair, Honorable Koros. But I don't let us first proceed because we also have the ministry to give us the direction.
Madam Chair, just one important issue that I want to pass across, and it should go.
Who is speaking now?
Madam Chair.
Yeah, please let's speak through the chair so that we can have some order.
Madam Chair, let me put it very clear that this issue of COVID-19 is a very serious matter. That as a committee we don't want to discuss this thing back and forth. I want to appeal to the government and to the executive that they fine-tune on their communication. This is the problem that we have. It could be not, perhaps maybe there is nothing that is going on about this issue of COVID. But when we have people from the executive coming with half-baked information, this is what creates tension and dotted line outside there. So I will appeal that any institution of government invited here, if they know that they are not prepared enough, they need to go back and prepare. So then we avoid all these gray areas. And I will appeal, and I'm sure I'm communicating to some people in the government. So then we have enough information. Public should be fed with enough information. Madam Chair, thank you.
Thank you very much. CS and your team, we've made a decision. Clearly, we need a better document. We'll give you time. You take leave. The information, the direction that the director was taking. That's what we need. If yes, you received, for example, this number of kids, how many are they? You know, we just need full details. Who received, then at what point were they handed over, and to who? So that from there we'll pick it up so that we can connect the dots. So otherwise, when we have these gaps, people will keep on speculating. So thank you. We request you to leave now.
Chair,
and we'll see you at 9:30.
The CS must be here tomorrow, Chair. I want this ruling to be done on. The CS Macharia must be here. We're not going to accept CAS to come and stand up for him all the time that he is avoiding this committee. It is unacceptable. Do we want to call it impunity of the last order? We will not accept it. I will not accept into that. And I want every member of this committee to be able, Senate as well as the National Assembly, to take that with me and second everybody here. We want to see the CS. Why is he not here? We are not going to accept tomorrow that we will not be attending this meeting tomorrow until he is here. We will not accept it.
You know, I'll rule you out of order, Professor. Because once we have documents communicated to this House, we also a House of Procedure. We cannot anticipate what will happen tomorrow. So order, members.
Chair.
We are allowing the ministry team to leave so that we can proceed. So, Minister of Transport, kindly take leave.
Madam Chair,
we'll communicate to the Speaker on this matter.
For record, Madam Chair.
Yes.
I did inform the House, report to the House earlier, that the CS has a commitment, and he always attends parliamentary committee meetings wherever he is required. But I said on this occasion, he is indisposed. And I'm saying, you've asked us to come back tomorrow. We will stress to the CS on the need for himself to come personally, if he is well enough.
Point of order, CAS, Madam Chair, allow me. Point, is it now, if I'm sure you have a role to play. That's why you are a CS and you are appointed. Whoever appointed you, His Excellency, must have seen your capacity. For you to come to the committee and pass back the issue to the CAS that he can be invited, it means you want to cast aspersion on your own commitment or that capacity to dispense government policy in Parliament. Do you want to challenge your capacity? I thought you are here on your own capacity. You've been referred, you've been sent by your boss to come and the reason why you are his assistant, it means you have that capacity.
Madam Chair.
Chris, I know you have the experience. You should not panic.
Madam Chair.
Now, I don't know why we are having this argument. We have ordered ministry. I think you need more time to go prepare yourself, give us facts.
Madam Chair, permit me to weigh in on this, please. Kindly, Madam Chair. We are not arguing. What I hear the members say, and I'm certain you've heard them, and the CS has heard. What he has said is very simple. He's going to place on the CS to attend tomorrow if he's in a position.
Yes.
It's as simple as that.
Yes.
But we need to place a team home that if the CS is unwell, we play for his quick recovery so that he comes and faces this team tomorrow.
But Honorable Member, I also want to remind you,
thank you,
Honorable Kagwe, that the last sitting, it's always good to be fair. The last sitting we had, the CS Transport came and appeared. And I don't think we have ever invited him and he has ever failed to come. There is a proper document forwarded to the clerk's office. So if there is a reason, all of us, anybody can be sick, anybody can have a commitment. So I don't think we need to really belabor on that point. We have directed the ministry. The most important point here, your document is not adequate. Go and prepare. Let's meet tomorrow at 9:30. Thank you.
let's go to the Ministry of Health.
Thank you very much indeed, Madam Chair. Madam Chair, could I just start by saying that indeed I am aware that my colleague is ill-disposed and would have loved to be here himself, because I personally spoke to him on my way here, wanting to know whether he is coming, and I'm aware that he is ill-disposed. So I think it's good also to clarify that and to clear that it is not, he did not leave, he did not come here intentionally. And I would like to clarify that. He wanted to rest the case with my friend, Sheikh.
Thank you, CS. Thank you.
Madam Chair, let me start from the outset by saying that I am here to clarify a number of things that have been raised both by Parliament, and by Parliament I mean both houses, and issues that have also arisen in the public mind as a result of the communication that has been going on in regards to COVID-19 in general, and specific issues that have been raised that involve matters of transparency, matters of management, and matters of accountability. From the outset, Madam Chair, let me say that when it comes to matters of accountability and matters of transparency, my ministry is determined that this is going to be the case. We are determined to clear every single item and every single issue that may be in doubt as far as this committee is concerned, this House is concerned, and the Kenyan people, because it is only fair and right that they do so. We have no intentions of protecting anybody. We have no intentions of hiding anything. And Madam Chair, I will do my best to clarify any issue at all that may have a reason between the time I was here and give specific details and the time and this time round. And just to say, Madam Chair, that it is important for this to happen. You have rightly said yourself that what happens is that when there are gaps, then you will find that people will make up, or creativity will intervene. And that creativity, while important and good, is also important to clear, because it plays around with people's reputations, it plays around with people's names, and so on, and people's careers. And especially at this time, when this disease is still ravaging us, it is still continuing, day in, day out. COVID-19 as a virus is not finished. It is not a past tense. It's a present tense. Today, we will be announcing some people who have got the disease, and tomorrow we will be announcing others. God help us that tomorrow we will have no deaths and so on. But I think it is good to bring it to light that as we discuss these matters, let us not discuss COVID-19 as if it is over. It is here and present, and will continue in the foreseeable future. And we pray to God that the people, that we do not lose any persons to this disease, as is currently happening both in Kenya and elsewhere in the world. So for me, Madam Chair, there are a number of issues that you have alluded to and have been asked to respond to. And what I propose is I will respond to the general questions. We have got the details of every single item that I'm going to mention. Every single thing I'm going to say has got an annex, a very detailed annex of what is included in it, and I'll be happy to respond to each one of those issues. Madam Chair, the first item I'm supposed to respond to by way of answer is the role played by the Ministry of Health in clearing Jack Ma's Foundation COVID-19 supplies donation and other donations. Madam Chair, let me just say this, that following what you have just heard, the clearance of any government donations is in the hands of the Ministry of Transport, as has been indicated. And indeed, we confirm that as the ministry itself has indicated, it is true that that's what we got. The general procedure of receiving donations in the ministry is through communication received from donors directly or through the Ministry of Foreign Affairs, informing the intention of donating commodities, equipment or services and their quantities, when to be received, and the point of entry or delivery. The ministry then gets in touch with the government clearing agency, which is responsible for the clearance of government cargo, to confirm arrival and requirements for clearance. Once the commodities are cleared, they are transported to KEMSA or to KEMRI for storage and subsequent distribution. In regard to JACMAV donations, the Ministry of Health received communication from the Ministry of Foreign Affairs for 3 consignments. Those 3 consignments are in Annex 1 of this document. The second JACMA Foundation donation came in 2 consignments. The first consignment was received from the government clearing agency on the 15th of April and cleared and delivered to KEMSA on the same day. Annex 3 of the document here spells exactly how that happened. And as Kas Obure had indicated, that is precisely what happened. The second consignment was received from the government clearing agency on the 28th of May 2020 and delivered to KEMSA on the same day. The details of the consignment are in Annex 4. The third JACMA Foundation donation was received on the 24th of May 2020 and delivered to KEMSA on the same day. That is Annex 5. In regards to local donations, the Ministry of Health was notified by donors on the intent, and continues, by the way, to be notified by donors who intend to support the fight against COVID-19, indicating what type of donations, quantities of donations, and sometimes the donors specifically indicate who they want to give their donations to, or what type of donations they believe are more useful than other times. And since this is a donation, we sometimes confer with them and agree. If a donor wants to donate to a specific county, we have no issues with it. We receive and take as they donate. Madam Chair, on the role of the Cabinet Secretary on KEMSA management and procurement of COVID-19 health products and technologies, Madam Chair, let me just respond as follows, and if you allow me, explain a little bit more. To say that the role of a Cabinet Secretary, not just MUTAHI KAGWE, the role of a Cabinet Secretary is to provide policy and strategic guidance and leadership, in this specific case to KEMSA, but widely in the institutions under each ministry. Madam Chair, this is an important question that you raised, because it refers largely to some of the things that I have personally been verified for regarding my intervention or so-called interference with...
Chair, point of order, Chair.
What is out of order?
I request Wasiri not to clean himself here, because as we have information, let him go direct to...
Honorable Koros, you can also not gag him, allow him to speak, then you can make your judgment. I think we have called him now to express himself. Once he does so, it is for the committee to come up with a conclusion. So let's allow him to proceed. Proceed, CS.
Thank you, Madam Chair, for the protection. Madam Chair, may I be very clear that the role of a Cabinet Secretary in any institution is essentially to give guidance, is essentially to provide leadership, and Madam Chair, all Cabinet Secretaries must at all times be in touch with the institutions which they run. Otherwise, what would they be doing? Madam Chair, in this instance regarding KEMSA, and in direct response to the question that you have asked, of course, Madam Chair, I have engaged KEMSA repeatedly especially over that COVID-19 period. And Madam Chair, it is my job to do so. It is my job to talk to the ministries. Madam Chair, as we speak right now, the KEMRI boss is here with me. We consult. Last time I was here, we were with the chair of Kenyatta National Hospital. We consult. There is not a single CEO that I don't consult with continuously, because, Madam Chair, it is my job to communicate policy, it is my job to communicate government strategy to the respective institutions that I have in my ministry. Madam Chair, in this specific case, for example, we were in a crisis. And Madam Chair, yes, we do not micromanage the institutions which we run. But we were in a crisis. And I can repeat, and I can give you examples of meetings that I had with the chair, with the CEO of that institution. I called in the people from Camry, and the bosses here. I called in even lab technologists and technicians to discuss in a crisis where we knew nothing about. Which are the reagents that we need? Where do we get them from? What are the other items that we are going to need to fight COVID-19? And Madam Chair, it is easy to forget how the situation was at that time in March, when the whole world was dying away. In some instances, we are being told 1,000 people are dying per day. We are not ready. Everybody in the country is screaming for PPEs. It would be totally irresponsible for me to sit in my office and not ask my executives and not try to bring everybody together from KEMSA, the laboratories in Camry, the laboratory in National Influenza Labs. I was bringing all these people together in settings so that we can be able to get a solution to a problem we knew nothing about, to a challenge we were not ready for. So, Madam Chair, I also communicated directly to the CEO and gave government policy. For example, I am the one who gave direct policy that going forth, because of the high cost of PPEs globally at that time, we were able and zeroed in on local production of the same materials, which cut the cost, Madam Chair, from 9,000 shillings, which was the global prices at that time, to 4,300 shillings, a cut down of over 50%. Now, Madam Chair, it's my job to communicate to the CEO and to say to him, government has made a policy decision that going forward, we are not importing PPEs, we are going to buy them from local approved suppliers. And Madam Chair, that is my job. That's what I should do. So I am at a loss. I was at a bit of a loss when I'm told that I'm giving directives or I'm trying to influence, I'm putting pressure. Madam Chair, I put pressure on each and every person in my ministry at that time. And in fact, Madam Chair, what I should do is apologize and thank them for the pressure in which they were working under. And I think it is important, Madam Chair, also to remember, there is an old saying in English, when the war gets very hot, even the generals go to the war front. And for me to sit in my office and do nothing would be totally irresponsible. And therefore, and I answer this question, not just in regards to KEMSA, but also in regards to other institutions, and indeed, in regards to government management. That's what we do. That's what my job is. And that's what I must continue to do if we are going to be successful in this fight. Madam Chair, if I may give another example. I have spoken. The CEO of Camry is here. We have been with him around the country. We were with him in Kilifi to try and detail and talk to people there about the possibilities of working for a vaccine, for this, for against this disease. And I have been with Combat to Kilifi for the same. That's my job, Madam Chair. It is my job to put people under pressure so that they can produce the results we are looking for. It is, however, not my job to tell anybody to commit any crime. It is not my job to advise anybody against anything that they are not supposed to do. And in the event that I told a CEO to do something that is against the law or something they are uncomfortable with, the normal thing to do in government is to say, give me what you are telling me in writing.
Point of order.
It is out of order. That's Honorable Tango.
Yeah, thank you, Madam Chair.
And take the opportunity to introduce yourself, and I can see you have a friend next to you whom I request to move to the next seat so that we keep social distance.
Okay,
and
thank you, Madam
also,
Chair.
if you are seated somewhere that is not written, sit here. No, you are seated in the wrong place. then take another seat. Thank you. Proceed, Honorable Tago.
Thank you, Madam Chair. Gabriel Chongoyo, MP, Narok West, and a member of this committee. Madam Chair, from the list of questions that are asked to the CS to respond to, there are quite a number. And I think it should be fair enough for him to respond to question 1, 2, and down, so that we probably come to the questions. He seems already to have jumped the gun, answering to what we even actually have not asked.
Thank you. I think CS be guided that you also summarize.
I am summarizing, Madam
Yes.
Chair, but the question is really quite clear. The law of the Cabinet Secretary on KEMSA's management and procurement of COVID-19 health products and technologies. Madam, that's what I'm trying to expound on.
Yeah, but you're already asking, actually answering like accusation. I'm sure you are referring to a question, or something that was raised in Senate, that you instructed, you kind of forced the procurement processes. So we have not reached that, maybe.
Madam Chair, if I may summarize on the answer to the question, I think the other role that we play and we continue to play on COVID-19 is this. Madam Chair, as we speak right now, we have a crisis. We have a crisis because we do not have reagents. The American government has blocked or has suspended the exportation of reagents for testing our people. Madam, it's my job right now to liaise with KEMSA, and I indeed spoke to them yesterday. What could we do? What is it we can be? How can we salvage the situation that we have got right now in terms of shortage of reagents? And right now we get reagents from anywhere. We buy them, provided it is the reagents that we have. So, by way of summary, Madam Chair, I just wanted to expound on that because it's an issue that has been in minds of Kenyans and it's been raised. Continuing on and moving on, the other question is, when did the Ministry of Health receive the consignments of donations from the Ministry of Transport? And I would like to clarify that and indeed confirm that it's very close to what was said by my colleague when he was responding, that the Ministry received 3 consignments from the Government Clearing Agency, Ministry of Transport, as follows. The Jack Ma donations on the 24th, first Jack Ma donation consignment, 24th of March, second Jack Ma donations, 15th, second one on the same, the second Jack Ma were received in 2 consignments, the first one on the 15th and the second one on the 28th. And the third Jack Ma consignment was received on the 24th of May 2020. And then, question 4, I'm supposed to give an itemized detail of the consignment. And, Madam Chair, the Ministry of Health, through the Ministry of Foreign Affairs, received a note board with an attached packing list detailing the contents of the nation as explained in this document that you have, Annex 7. Madam Chair, on the issue of the status of medical supplies, and in particular, the personal protective equipment in the country at the moment. Madam Chair, the provision of the PPEs is a continuous exercise in COVID-19. And I would also like to clarify here, Madam Chair, that the PPE is an essential commodity in medical care, not just for COVID-19, but even for other conditions and other infectious diseases that we have. The only issue, of course, is that the speed at which we are using the current PPEs is very, very high. And Madam Chair, I think it is important for us to highlight to everybody, and to the committee in particular, that the biggest problem with these PPEs is that they are essentially not reusable. It's an item that costs 4,300, used once and disposed. And then we have got to get another one. And in fact, Madam Chair, if I may inform the committee, the exercise that is, some of the exercise going on now, is to try and see whether we can be able to find ways and means of reusing some of these PPEs. But we cannot do so to risk doctors and nurses. We can only do so once they have proved that, that what I'm asking them is possible. And the demand, Madam Chair, will continue to be high for as long as the current nature of the disease continues. The PPEs in health facilities and communities have been availed by the Ministry of Health through procurement by KEMSA and supplemented by donations, as explained in this document in Annex 8. But there are also other sources, including procurement by county governments themselves, both from KEMSA and from other sources, as we agreed, and the President waived the issue of procuring from KEMSA so that they can also buy from locally approved producers. But in addition, the COVID-19 Emergency Response Fund Board has distributed PPE kits to health facilities across the country. Using its capital fund, KEMSA procured also PPE kits, as was presented in their submission to this Committee of Health. I thank you, Madam Chair.
Thank you, CS. I'll give this to the members. We first take the first round, and then we can have the second presentation on the finances. Then we can see Honorable Koros, Honorable Joyce. That's Dr. Eseli, and as you introduce yourself, kindly, as you ask the question, introduce yourself, Professor Owino, and I'll finish with Tongoyo, in that order.
Thank you, Chair. Thank you, Bwana.
Honorable Koros.
Yes.
Chair. You know you're supposed to lead by example, so put. Thank you.
Thank you, Chair. Thank you, Bwana Wasiri. I have just one question, Madam Chair, to Honorable Waziri. Waziri, you said you didn't interfere or you don't interfere with your CEOs under your ministry. But kindly, Waziri, may I know what interest or relationship do you have with everywhere investment or distributors, the company which supply KEMSA with PPEs?
Honorable Joyce.
Thank you, Chair. Thank you, Chair. While I appreciate the involvement of the CS and coordination of the sagas under him, and the constant regular consultation, I also want to appreciate the urgency that is usually expected in an emergency. Our main concern really was, in the last meeting, was when we were informed that a procurement of 738 million was done by KEMSA through a letter that was sent by the PS indicating the list of items, which was okay, but also the list of prices and the list of suppliers. And when we asked KEMSA whether that was procedural, because we were wondering whether the ministry did the procurement procedures, and I think KEMSA also confirmed to us that it was not procedural. So that is where we are coming from. And our second concern then, the other concern was a very large procurement by KEMSA of over 7 billion, apparently without consultation or maybe even approval, which I think the ministry will tell us whether that was the case, of items that we might even incur losses in price differences, or even warehousing these supplies indefinitely. We were wondering what the ministry is also planning to do with these items. Thank you, Chair.
Thank you, and I'll request Honorable Joyce, you hold on the answer of that question, because the submission be from the Ministry, I guess, covers, so you allow them to do their submission, and then I'll give you the first chance to interrogate the answer. Honorable Eseli.
Thank you, Chair. I'm Honorable Dr. Eseli Simiyu, MP for Tongaren. Waziri, there were some disturbing rumors that the Jack Ma donations were stolen, then sold back to KEMSA. Now, those were very disturbing rumors, especially if we are talking about a donor who has helped the country. I don't know if there was any truth in this, and if you know anything about that. Then lastly, I think, Waziri, you must be quite disturbed that KEMSA is holding stock worth 6 billion shillings, which was purchased at the height of the pandemic at very high prices, and now they're having difficulties selling them at the current prices, and it will result in a very serious loss to KEMSA.
Thank you. Prof.
Thank you very much, Chair. Thank you very much, Waziri and your team, for coming to present to the committee. I think exoneration is obviously one thing, and so that is acceptable, and that is obviously something that really needs to be done, both in public and in committee gatherings. So listening to spinners of unconfirmed information, or spiners, as some Kenyans accent use, listening to spinners of unconfirmed information must be known. We're not here because of the media reports or spinners or any other thing. Parliament is aware, the Parliament is aware that everyone remains innocent until proven guilty, including all your staff and members and all that. So having said that, it is inferred to your guidance and obviously understanding that we want to know what efforts you have done to undertake a clear correction of the issue in place. And obviously, you are here, as you have mentioned, your role is to provide policy, strategic guidance and leadership to KEMSA and any other institution that comes under you, or any other saga that comes under you. Fair enough, that is quite understandable. But we want to know the efforts you have undertaken to make a clear correction on the wrongs that happened. And a declaration of that will obviously be a strength to exonerate anyone who might have been implicated on such matters. Foundation, since the red flag has been raised, so that we know your suffices the responses required to such challenges. Those are my two questions. The previous one was to set the tone. Thank you.
Owino.
Thank you, Chair. First of all, let me thank CS and PS and the team. You have done a tremendous job. What this committee is trying to do is to have a clear statement to put the ministry where they should be and squarely where they should be. But Madam Chair, allow me a second to ask a question directly so that I can proceed with this, because if I don't get it that way, I will be stuck somewhere. So, CS, is KEMSA a state corporation? Yes or no? Yes, it is. Is it governed by the State Corporation Act? Yes, it is. Now then, when we're looking at that Act of 2012, you as the CS, Part 4 of that corporation, Cap 446, says that state corporation and control of finances. Every state corporation shall cause to be prepared and shall not later than the end of February every year submit to the minister and Treasury for approval, number one, estimate of corporation's revenue and expenditure for the following financial year, accompanied by the proposals and project to be undertaken. That's really squarely false in your docket. And that brings me to question, if KEMSA, out of their revenue, which we had requested, Chair, that we be given exactly the annual revenue in those 10% and whatever they make on their own, around 4 billion, and they go overboard to buy consignments, 7.2 billion. Doesn't it then occur that those should come to you because they were not in the previous budget? Maybe the Treasury is not aware of it, so that you can have some approval to it. Or is it just a corporation that is determining what they want and do what they want? The other statement, Chair, which is correct, in section 15 of the same act, and this is where you are alluding to, as we appreciate leadership, guidance, consultation, I think they were anchored on this. When it comes to accountability, then board shall be responsible for proper management of the affairs of the state corporation and shall be accountable for the money's financial business and management of the state corporation. That squarely fall on the board, and it's in the act. That's why I acted in the first place. So that is what you are trying to say, that you are not micromanaging. But the other aspect, in fact, the same act says the CEO can only be called to ask questions, that the board makes decision. But the annual estimates that comes must be approved. So did you get to know, or some kind of approval, that KEMSA was going to purchase 7.2 billion worth of goods? Lastly, as you know, CS, we are still in the quagmire of this disease. Nobody knows when it will weather off because of its mutation nature. We don't know whether it will mutate up or down, become aggressive and all that. We don't know. So we are still in the fight. But as we are fighting, these members of parliament will tell you, in our constituencies, the healthcare providers are still reusing masks. Some do not even have the masks. Some have the wrong ones. But KEMSA State Corporation is warehousing 6.2 billion worth of merchandise. Whether they are trying to make money of it, I don't know whether that is ethical practice or not. No. Now you as the person at the helm, what do you direct? What do you guide? Because they were here and they said they need some authorities in order to dispose those. In times of pandemic, you may not care for making profit. And when you will be responding to that, tell us also about the 300 million masks. When you mention Chamber of Commerce, it's foreign to us. When we gave the money, we wanted masks to be given to the impoverished community. Right now, they have not even got it. He says, yes, this money was not meant for job creation. This money was an emergency. So you can also tell this committee what the Chamber of Commerce is doing in that arena. Thank you, Chair.
Thank you. We can finalize the first round with Honorable Tongoyo.
Thank you, Madam Chair, once again. Gabriel Tongoyo, MP Narok West. I've got just a few questions. One, I want to congratulate the CS for at least for the effort he has tried really, to combat this pandemic. And Bwana CS, when you came into this ministry, it's good to be fair, we saw a man full of commitment and energy. But just before you settle down, you made a personal confession that the ministry that you are heading is full of cartel, is a mafia house. And you really confess, even before the cameras. We want just to tell us, as you stand now, what is your fair assessment? How do you rate it? Another question, on matters of the PPs, and I think, Madam Chair, I ever said this before this committee. I happened to have been to one of the government facilities, and there was a whole container which purportedly was packed with the PPs. And to our surprise, I was there when it was overloaded. We found a whole container full with napkins. I don't know they were part of the PPs, but they are full of napkins. It was really very disappointing.
Honorable Tago, could you clarify full of what?
Napkins. I don't know, napkins are also part of the PPs.
What, Pampers or?
Pampers.
Okay.
Pampers.
No,
in our total. So maybe they will tell us whether they form part of the PPs. That's in the facility. They say yes, but it was not supposed to be those quantities. Maybe they will tell us more. Bwana CS, lastly, as the CEO in this ministry, do you normally make a follow-up of these items, donations, supplies, whether they are really reach the designated facilities in this country? So, right? Lastly, I know this is one of a question that you really try to explain on your opening remarks. I think there was a big allegation from the KEMSA CEO in the Senate saying that you really kind of pushed them to disregard the procurement processes and procedures and award, the tenders against the procedures. And actually, I think he actually made the confession under the oath. So I don't know, you need to come up a little bit clear on this again. Because I'm sure when the pandemic was declared, we had a little bit of some time, and any responsible CEO or manager will at least put in place, some measures so that when it was declared in this country, we will have been in a better position to follow the procedures, so that we will not have gotten ourselves in a mess we are in at the moment. I think that is all I have, Madam Chair.
Thank you, Member for Narok. And I'm sure you are referring to, you said PPEs that were delivered in the spinal injury hospital?
Yes, spinal injury hospital.
Part of the PPEs were diapers.
They are diapers.
So just one qualification that diapers is part of PPEs.
Yeah.
Okay.
Thank you.
CS, you can proceed so that then we will take the next presentation. I am very sure some of the questions that we have asked also, Honorable Tongoyo, they are part of the submission that the PS will also make. So if they are not well exhausted, we will be getting them maybe the answers for the clarification from the PS.
Thank you very much, Madam Chair, and thank you for the questions. Madam Chair, let me just start by the question by my friend Koros about the issue of the companies. Let me state here, I have no interest. In fact, Honorable Koros, I didn't quite hear the company that Honorable Koros was referring to. But let me just say, I have no interest in any company at all that is working or trading with PPs. There are over 60 companies. The companies that deal with the supply all sorts of materials at KEMSA, to my understanding, are more than 60 companies. And I have no interest in any of them that has either supplied or going to supply. So just to clarify that position.
Chair.
And also,
Honorable Koros, can we let him first respond, and then I'll give you a second chance. Thank you.
Thank you. The other question, so just to clarify that, I have no interest. And then on the issue of, and Madam Chair, again, just to rest that case properly, I've been in this ministry for about 6 months now. I did not trade before, and I'm not trading after with the ministry. Madam Chair, on the issue of the 738 million, you rightly said, the PS is here with me, and she will explain everything about that 738, which is part of the 1 billion that was given by the World Bank. But let me just explain a matter of procedure, which I think is critical and important. Madam Chair, the normal procedure is that the listing of the companies, the listing of the prices, in terms of the World Bank procedure, because the World Bank itself has also got its own procedure of how we are supposed to spend their money, how we are going to source, and so on. And Madam Procedure, documents with us here will show two things. The first one is that it is KEMSA that originates the document. Essentially, we send letters to KEMSA that say we are looking for the following items in accordance with the needs that have been surveyed and identified and analyzed by our doctors and all the people who go around the country. We are also looking at needs as they have been presented to us by the county governments. Based on these needs, this is what we need and this is what we require. On the basis of that communication, KEMSA will then come back to us and say, we have analyzed and seen the needs that you have. This is where it is available. It is available at these prices, and it is available from these sources. Subsequently, particularly in the case of World Bank, once they send us the schedules of who they have found and the prices that they have located, an approval will then come from the ministry that says, we have looked at what you have. These things are a bit expensive. These things are okay. Please procure in accordance with your own list, which you have supplied to us as follows. And we attach the list, which is sourced from KEMSA. That's the procedure. And that is the letter that is being referred to by Mheshimiwa. So the PS will explain that in detail, but in terms of procedure, that is what is supposed to happen. And therefore, when a letter comes from the ministry and indicates the companies and expenditures, then taken from the wrong side and said, now you are ordering KEMSA to buy only from XYZ and ABC, that is not precisely the version. The correct version is that, yes, this is World Bank funding. In accordance with their procedures, tell us who you found, tell us the prices you found, and in some cases we have told them we can't buy those prices, go and look for lesser prices from the manufacturers, etc., etc. So these documents actually originate from there, and then they are sent back to them as confirmation that we have looked at it and approved, and we do so also in concurrence with those who are funding that particular program. That's just for clarity on that, but the details are with the PS. On the issue of losses, this question has a reason. I think a number of members of panel, honorable members, have raised the question of the prices and what is going to happen. Madam Chair, by way of reference, if you look at the state of our nation at the moment, and not just ourselves, if you look at the world stage and the economy in the world stage, at the time that we were procuring these items, the prices that are given were the prices that were prevailing at that time. Now, Madam Chair, in fact, part of the reasons why Kenya went and our prices dropped before the other African countries were actually dropping their prices is because we were able ourselves to start manufacturing locally. And Madam Chair, when we do the cost-benefit analysis of this loss, because it is a loss, when we do the cost-benefit analysis of this loss, we must ask ourselves the following question. Had we not started the local production, the prices would have maintained themselves at that price, and given the quantities of prices that we proceeded to buy, what then would have happened to us in terms of the pricing. And Madam Chair, let's not also forget that the rush to buy these items was there because of the cry that was there amongst our nurses and doctors and frontline workers. At that time, it was while the price is critical and must be surveyed, the important issue was to save our nurses and to save our doctors who are fighting on the front line. We have no idea what would have happened, what lives we would have lost had we not purchased the PPEs. I'm the first one to admit, Madam Chair, that subsequently the price went down. And even globally now, because of stabilization, the prices are still down, even though in most places it is still higher than ours, at the 4,300 and coming down all the time. Madam Chair, even rents in this country have come down. Every single business is going to take a hit. If you have got, my personal business are good, even the Hilton Hotel will take a hit. It doesn't matter what line of business you are in, every business is going to take a substantial hit because of COVID-19. Here we are with an organization called KEMSA, who bought PPEs at 9,000 at whatever other prices. And it's not just the PPEs, even other commodities and other government agencies and other private sector agencies. The prices have come down as a result of lack of demand, as a result of just lack of a poor economy. All these prices will come down. My view, Madam Chair, is that we have no choice but to do two things. First, these PPEs are required, as the Honorable Wino asked through the Chair. These PPEs are required across the speak. And you see, my position, and this is my advice to the board, is that you cannot buy an item expensively, retain it in your books because you don't want to show a loss, keep it there permanently because you bought it at a higher price, while the prices have actually dropped. The business-wise thing to do is to ask yourself, can I be able to dispose with them at whatever price right now? Because you might think that you are going to dispose them at 4,300 today, which you can, but if you wait long enough, you could actually end up disposing them at 2,000. Because what makes you think that the prices can only go up towards what you bought them at? They can come down, and the loss that you are going to make could even be higher. So normally, business sense is that you survey the market and make a decision based on the prices now, undercut your losses, trade yourself out of the losses, make decisions. Is it cutting prices? Is it cutting operational costs so that you come back to base and recover your losses? This is business, and you must make a decision based on that criteria. But the more important thing here, Madam Chair, is that we are talking about PPEs that are still required. As the honourable members have said, in some of the places, PPEs are not there. Yet they are in the KEMSA warehouses. And a decision has to be made. You cannot keep 9,000 because you bought something at 9,000, and you say that you cannot distribute it to counties unless they buy at 9,000. They will not buy them at 9,000. Take a hit, distribute these things, cut your losses, and then look at how to recover yourself from from your operations, just like every other business in Kenya is going to have to do. On the issue of Honorable Eseli raised the issue of rumors about the stolen PPEs. I think, Honorable Eseli, we have gone through a very detailed analysis and presentation of the JACMA items. And in this document, which has been distributed in the annexes, you'll see a very detailed analysis of the JACMA and all other donations that we have received. And the reason why you have neither had the Chinese government nor the JACMA organization claim that or make any noise at all, in fact they are probably thinking about giving us more, is because they have looked at all these things and they have determined that nothing has been stolen. And indeed, if it had been stolen, I am sure by now, given the public outcry that is there, somebody would have been arrested. But you see, Madam Chair, when somebody says that, items have been stolen, some of them are even supposed to have gone to Tanzania in accordance with some of the exposés that I hear. And I wonder why Tanzania, because as far as Tanzanians are concerned, there is no COVID. Why would you take Jack Ma items to a country with no COVID? So Madam Chair, I just wanted to raise that and say we don't have any reports of any theft. What I probably would say to that is that if indeed it was true, we would have the details that we have got this we received this package, and out of this package, KEMLI or KEMSA did not get that package. Then we would know, but we have all the details. And in fact, the documents were also tabled here from KEMSA itself. On the issue of the price drop, I think I've addressed that particular issue. Now, Professor Sheikh, on the issue of what steps? What steps? Well, you know, what have we done? And, you know, Madam Chair, it's important for us to point this out, that we had two instances. A, we had our own internal audits go to KEMSA to try and find out what the issue was. And I'll tell you, Madam Chair, something that is probably not in the public domain. When we were sending our own auditors to go and look at KEMSA, we were not just sending them because of COVID-19. We were sending them to assess the issue of efficient management, because there is efficiency and there is matters corruption and matters efficiency. And we are looking at both. How efficient is our system? Because this followed some complaints even from some of our donors who wanted documentation. They wanted documentation clarified. For example, if the Global Fund is giving us some money and they want communication to tell us, we gave you this money, therefore please, can you please give us the accounting of that money, who you procured from, who you did, just like the World Bank I have just explained. And when they ask for those kind of things, you want to give them to them instantly. You want to give it to them immediately. And when that doesn't happen, they come to the ministry and say, we are giving you 40 billion shillings. Yes, we can see the items we are getting, but the accounting procedures are not right. So it is our responsibility. The second thing, Honorable Chair, through the Chair, is that it is important for us also to know, and for you as a committee and the country to know, the investigations that are going on and have been going on, and the President, of course, said that they must be closed, but they must finish very quickly within the next 21 days from when he announced it. It is important for us to appreciate. We are the ones who actually, I am the one who invited these people to come and carry out those investigations. If we had something to hide, I would never have invited them. So I think it is good for us to appreciate. They did not come on their own volition. I personally spoke to the DCI and said, please come to the, not just, by the way, it is not just KEMSA. I said, even the ministry, come here and advise us. Where do you think the loopholes are? Where do you think everything is, things are going wrong? So it's at our invitation that they came. And if I had something to hide, all of the management that we have had something to hide, we would not. And it was in response to the same thing that has been asked by Mheshimiwa, that what is it? How now, what is the rating now? Between when I went there and what is happening now? Let me just put it this way. It is work in progress. We have made serious steps. We have transferred and mixed people, and I must say that the fact that a person has been transferred is not an indication of guilt. It is simply normal, efficient management transaction. So that we start anew in some areas. Some other transfers have been delayed for a long time. For example, a procurement person is supposed to be transferred 3 to 4 years. So when people have been there for 7, 9, 12 years, 30 years in some cases, then it is only fair that that be done. So yes, we are taking steps. We will continue to take those steps to create the efficiency required. But it's not just efficiency not to steal. That's not what we are trying to do. It is efficiency not to steal, but it's efficiency to be able to deliver healthcare to Kenyans. Because by the end of the day, in spite of all the discussions we are having, in spite of all the demands on us, the purpose of the ministry is to deliver affordable healthcare in time and efficiently. So the changes that we are making are also part of that. Because when you ask how do I rate it, I would say that it is work in progress, but we have made many steps in terms of creation of efficiency, in terms of a very good relationship with the county governments and county governors, because we cannot deliver universal health care unless we work with the counties. These are some of the gains that I would say that, that we have made. I think a lot of the issues that Honorable Owino raised in regards to the clarity of the relationship between our sagas, our prostators, our hospitals that run on their own, in terms of the boards and the role of the board that you rightly raised, Honorable Owino. I think it is important also for us to appreciate that policy communication, and when there is a crisis, as I said, procurement rules, there are very specific procurement rules. Emergency procurement rules allowed other emergencies, and these are carried out in the various organizations. And what happened at KEMSA, and I think this is what even the chair of the board said, is that they quickly formed a committee, a procurement committee, that can be able to fast-track those things in accordance with the state of affairs of the day. So at no time would I, as the CS in the ministry, propose to anybody that do not follow procurement rules. The procurement rules that you follow will be in response to the environment in which you are in at that time. So, for example, if you are procuring for something that is not an emergency, the procurement rules are clear. And at any time, the procurement authority knows exactly what is going on. And when you go wrong, then you don't go wrong because the CS told you to go wrong. You go wrong because you're a poor manager. And you don't know how to manage. And you don't know how to use the law in terms of procurement procedures. So that's a management issue. It's a micromanagement issue. What is the law regarding procurement? And I cannot go otherwise. And if any CS or any board chairman were to ask you to do anything that is not within the bounds of the law, then you must tell them, Bwana CS, this is not what the law says. Please give it to me in writing. If that is what you want, if you want me to break the law, give it to me in writing. And then we can take it up from there. So my job has never been, and will never be, to ask anybody to break the law, any saga, any organization that we are in, and I haven't. But so it is up to an individual. You know, Madam Chair, somebody cannot say that you told me, just by way of example, that somebody told me to go and steal Honorable Owino's coat. And I steal Honorable Owino's coat and say, you know, it is Jimmy Angwenyi, Honorable Jimmy Angwenyi, who told me to steal Honorable Owino's coat. Life is not like that. You know, there's no logic to it. So you cannot cry. Anyway, and I think Honorable Owino, the Madam Chair, Honorable Owino through Madam Chair, what you said is absolutely correct. In regards to the laws and what you cited, when it comes to day-to-day...
Your microphone.
Yeah,
okay.
When it comes to the day-to-day management of an institution, you cannot go above a budget. Yes, you give us a budget. We'll approve the budget. We will then take the budget to, as you said very rightly, in February. In this particular case, as you recall, I went to the ministry at the end of February. But the point is that yes, that what you said is correct. A budget must be brought from every saga. Once the budget has been approved, it is taken to the Treasury. Following that approval of the broad operations of the organization and moving forward, what then happens is that the board approves things in accordance with that budget that has been given. In other words, if you go over budget, the only people who approve budgets is the board. So if you go over budget without the board approval, then clearly you are swimming in your own wild waters. And from then on, you are actually personally responsible, for those situations. And that happens in all the boats in accordance with what you have yourself lightly pointed out. Now, just to finalize on the issue of the 300 million masks, I am aware that the chamber itself will come, but I think that what happened, Madam Chair, to Honorable through the chair, is that the procedures for, and a decision was made between the government and in fact within the conference of the Council of Governors, that what we are going to do is that we are going to distribute the making of these masks to the counties, to and the most viable institution at that time was the chamber, so that they can go and distribute them, make them with their members in the various counties and distribute them there. But I think what may have brought the delay is that KEBS also insisted that yes, we are going to make these masks, yes, we want tailors and other people to do, but they must also be approved by KEBS for use, for use by various individuals. So I apologize. I apologize for that delay. It should not have happened. And I think that KEMSA must fast track that as quickly as possible, and the chamber must fast track the making of the masks. Because, Madam Chair, it's also right, if we can, whenever we can, it is also right that we try and raise, and give people in the villages some sort of work, so that we are also addressing their plight, and we are also addressing the economic challenges. So, and that's why we have got all those things like MUTAHI and so on, is mitigating that circumstance. As I finish, Madam Chair, I think that one of the issues that also came up is KEMSA and the 6.2, some issue on the 6.2 billion stock that they are currently holding. I think I also answered that question, that yes, they are holding some serious stocks of PPEs. We need those PPEs in the country, and I don't think that they have a choice except to look at it and sell it and be realistic about the current market prices. Waiting does not mitigate anything. I thank you and submit.
Thank you very much. Honorable members, I'll ask for indulgence if you would allow the PS Muchache so that we can go through the figures, and then after that, then we can do the next intervention kindly, so that we...
I have questions for the Honorable Senator CS. Kindly, if you could allow me.
Is it something that can wait, then we ask all of them together? Honorable Jagagwa, kindly.
I might lose track when the PS comes. It will be another set of questions. I might lose track. Let us.
Sorry?
Madam Chair, the position on this matter is very simple. With your information. In as much as we are constrained for time, this is a matter that has actually gained notoriety.
And I still ask you to wear your mask properly.
Thank you, Madam Chair. So, I was saying, in as much as we are constrained for time, this is a matter that has gained notoriety. So we need to give Kenyans all they deserve.
Proceed, Honorable Jagagwa.
Madam Chair, thank you. I'll make two statements and then ask three questions with your kind permission. One is because under Article 95, we speak for Kenyans, we speak for people. Some have approached us and some have approached me about the matters of reporting by our very good friends, members of the fourth estate. So kindly, as you take this reporting, as you make the reportings, make it as factual as it was. Let us avoid sensational reporting, because it might hurt careers. That is my first statement. The second statement, Madam Chair, is under Article 227 of the Constitution, that each and single cent of the Kenyan taxpayer money must be prudently utilized. Now, permit me to ask my questions. We did set up, Honorable CS, we did set up a COVID emergency fund. I think you appeared before us under the delegated registration, and we set up that fund sometimes in April. So my first question on that is, how much money either in terms of government funding, in terms of donations, grants. How much money has gone into that kitty since it was set up? The reason I'm asking that question, and this brings me to my second question. I've seen a folder where you have elucidated the items that have been bought, where you have also, there are some correspondences from the CS Ochache, especially the letter of 15th April 2020, which we shall come to later. I've also seen a letter, some correspondence from Mr. Murevi, the commercial director. There are letters from Jonah Mwangi Manjari, the CEO KEMSA, literally seeking for money, literally begging for money from the ministry so as to pay off COVID-19 suppliers. So if there's money in that kitty, why are the suppliers not paid? My second question is that it's on the issue of masks. When Waziri you've been here, I think this is the third time on matters of COVID-19. And we have talked about the issue of masks, that there's 300 million in the kitty. Masks have to be bought for the vulnerable members of this society. That has not been done. It's about 5 or 6 months since we got into the COVID era. The masks have not been bought. You have explained severally that there is an arrangement, or you're about to enter into an arrangement, or something is in the offing between the ministry and the Chamber of Commerce for the making of these masks. I'll let you know that as we are still grappling on how the masks will be made, how they'll be distributed, Kenyans, those are vulnerable, still do not have the masks. So it's up to your office, it's up to your ministry to hasten that process. But of most pertinent, and which brings me now to my question, is that the chairman of Chamber of Commerce, Richard Ngatia, he is supposed to appear before us tomorrow morning, and I'm certain that is one of the questions that will arise. Unfortunately, his legal team has written a letter to this committee saying that they have a case pending in court and will not attend. What would be your comment on that matter? Now that the person who is in charge of the Chamber of Commerce, whom the ministry is entrusting to provide and make masks for Kenya, does not want to appear before this committee to explain about the masks, what would be your comment as a
Just for information, I'm well advised that letter has been withdrawn, and the Megascope, I think that was not on Chamber, it was on Megascope, that they still appear tomorrow. Just for information.
I stand guided, Madam Chair, but you see, when we come to discuss about Jack Ma and other issues, supplementary issues will come up. I know that the minister, our Waziri Cabinet Secretary, this is the fourth or third time he's saying that the Chamber of Commerce is the one who is going to make the masks. But the gentleman, Richard Ngatia, does not want to appear before us. Who shall we pose those questions to? Would need his clarification to confirm what the CS is saying. Because we have had it severally from one party. So we need him here. So that is why I'm asking, what will be his comment? What is his comment that the chairman of the chamber does not want to appear before us? Honorable CS, my last question is that you've explained very well the role of our CS, giving guidance and policy directions to SAGAs, semi-autonomous organizations that are in his docket, or a docket for that matter. Letters have gone to and forth from the ministry to KEMSA, and one of that letters is the one of 15th April, where the CS, and I'm certain she'll explain herself out about the contents and the basis of that letter. But at the bottom of that letter says, ignore all other communications on matters of this procurement and give to these companies. That aside, when KEMSA appeared before us last week, they gave us information. One was the companies that were procuring COVID-19 items for them. The list of directors, the status of the companies, that is CR12, a certificate from the register of companies showing who owns what company. Now that brings me to this question, Honorable Waziri. Now that you are giving policy directions to KEMSA, there is one particular company called Lego Freighters. It's a Mombasa company. Going by the CR, that is the list, the certificate from the register of companies. That letter, or that company, Lego Freighters, has two directors, Rashid Mohammed and Isa Aden. Nature of business, the nature that this company carries out is clearing and forwarding. How then on earth there's a company that carries out clearing and forwarding business? And it is a business name, not a limited liability company, a business name with two proprietors. Then how on earth does that company qualify to supply, not to clear COVID-19 items, but to supply surgical masks, 60,000 packs, totaling to 270 million. How did you allow that to happen at KEMSA? That a clearing and forwarding company now supplies COVID masks. I think for now, I'll rest my questions at that. Given another chance, I'll hand over.
Thank you. I'll allow, I think the Vice Chair has not spoken. And Senior, I've allowed you to ask many questions. I hope the others can just make them quick and to the point so that we also save time. So Vice Chair, and then the CS can respond. Then we go, because I can also see members you are leading to the presentation that will be done by the PS. And I also noted that Honorable Jogagwa, you are referring to some documents in the second submission that we have not gone through them. So might be some of those questions. I'd request the CS you hold on, and the presentation is done by Madam PS, then you can respond to them.
Thank you, Madam Chair.
Vice Chair. Yeah.
Madam Chair, as I had said earlier, one of the biggest challenges in government is communication. Waziri, the way you've come out today, it's a bit clear, which it should have been done by the ministry from the onset. But Waziri, having said that, the reason why the committee is following up on this issue of COVID, everybody appreciates your role and the mitigations that you're putting in place. But the elephant in the house and the big question, Kenyans want to know if there is any money that has been lost. It negates any effort that has been put in place by government. And that is why there have been a lot of issues, people saying that the issue of COVID, perhaps maybe it is not fake, perhaps it is fake, or maybe this COVID doesn't even exist. Luckily, we have, fortunately, there are many Kenyans who have come out to confess. And that's why I want to send this quick recovery message to Honorable Moses Kuria, who is in the hospital, recovering over COVID. Waziri, KEMSA came here, and the procurement entity on this COVID-19 is KEMSA. The CEO is on suspension over issues of KEMSA. You are the minister who should carry responsibility on any issues happening in the ministry. Could you be in a position to tell us how much was bought by KEMSA? And then 2, from your own internal investigation, how much money was lost in this procurement process by KEMSA, and why KEMSA CEO is on suspension? And then 2, Waziri, it is in public domain, and you've just said it, and you put it clearly when you started. It is to the ministry, and particularly you, to convince us and Kenyans that you never interfered. And I will ask you, how many times did you visit KEMSA? And if you did so, what was the engagement between you and the CEO of KEMSA? And then thirdly, was there any communication on SMSs between your office and KEMSA to manipulate the tenders? And then thirdly, we rely on donor funding. The government on its own has a lot of challenges and doesn't have enough financial capacity to mitigate on this disease. And we rely more on international financiers and donors. What is the relationship between the government of Kenya or the Ministry of Health and donors arising at this time of COVID investigation? You've just put it very clear that there is an inefficiency in KEMSA, and by extension, the ministry. Will you wait until investigation is concluded, yet you've confirmed that there is inefficiency? What urgent action are you going to take? Lastly, as a senior person in this country, there was this COVID expose that lists a number of people and companies associated with who is who in this country. What is your take on this expose? Why am I saying so? Waziri, I have not had an official communication from the government on this issue of COVID billionaires expose that became so sensational. And I would say it, of course, character assassinates some people and some companies. Do you think it is fair? And what is the intervention going forward? So then you avoid unfounded truth, if it is in the ministry. Thank you.
Madam Chair, if you allow me,
yes,
I think that there are so many issues that are related to the next presentation.
Okay.
That if you allow me, I can very briefly respond to the two and then hand it over to my peers to respond to the other matter.
Chair.
Okay, you can proceed. Honorable Koros, just hold on because you have had a chance. Just answer those briefly and so that we can go to the presentation, and I'll open another round. So just hold on, Honorable Koros. I'll give you a chance. Hold on.
Madam Chair, let me respond first to the issues raised by the Honorable Jagagwa on the matter to do with the emergency, the COVID emergency fund. I think, let me explain that very briefly to say that the emergency fund that was launched is a private sector fund. As a ministry, and there are two funds, by the way. There is a fund, and I'm sure you are referring to the private sector fund that we are talking about, because the rest of the money is managed at the Treasury. But in terms of the private sector fund, the one that is, we do not, the ministry does not participate. The ministry does not know how much money. We are not engaged in the private sector fund. We don't have anybody in the fund. And in fact, What the fund does is they procure for themselves, they distribute for themselves in the areas that they so wish. And you have seen them around the country distributing where they have analyzed for themselves that there is a need. But on the part of the ministry, we have neither put any money there nor participated in as far as their day-to-day operations are concerned. You are right, Honorable Kagwe, through the chair, that indeed KEMSA has written to us seeking for funds to mitigate or to pay the suppliers that they have. And there are two reasons that we have held back on this. The first one is that the money simply isn't there. As you know, the economic scenario at the moment is a serious situation. And that is why we have said, and that is why I'm seeking also for the views of this committee on this matter, that there is no need for us to give KEMSA money or for us to seek money for KEMSA from the Treasury when they are holding stocks of materials with them. I think the normal thing to do, like any other business operation, if you get into a crisis, you look at what you have, you sell some of what you have, so that you are able to mitigate your losses. So in my view, what KEMSA should do is to sell what they have, so that they can be able to pay suppliers. Because if they say that they wait for Treasury and they are holding stocks, why are they? I mean, it's normal business practice. Sell what you can, pay the suppliers, cut your losses. If you are going to make losses, you make losses. But at least sell, pay your suppliers. That is what everybody else in the country is doing. And I think that is what they should do as well. It is only after they have mitigated everything, when you have sold your stocks, when you have managed to trade yourself out of some of those things, then you come and say to the shareholder, I have made a loss this year, what then do I do? And you are told, show us how you are going to cut your operational costs, show us how you are going to increase efficiency, show us how you are going to mitigate operational issues through ICT-based technology like the President ordered the other day. Let's do all those things, and then we can look at the accounts. But I think that it is not right for us to start funding an institution when they are holding stocks. Let them sell their stocks first. On the issue of the masks, Honorable Kagwe, through the chair, I cannot apologize enough on this thing, because whether it is KEMSA or whether it is any other institution, it's in my ministry, and therefore the buck stops with me. And on this one, I apologize, because honestly, my feeling is that it should have been made very, very quickly. But I also appreciate the fear that is there now amongst all the operators, that if they get one step wrong as far as the procurement is concerned, they and I will be back here explaining that particular issue. So I think, to be fair and in mitigation to my apology, is to say that I think we are just trying to make sure that they don't eventually end up here answering the question of something that they could have avoided. So all I can promise, Honorable Kagwe, is to fast track this. And on the issue of us and the chairman, I think the chair has rightly guided that the chair of the chamber will be here. I think it is in his personal capacity that perhaps the communication had come about. But when we are dealing with an institution, we deal with the institution, not individuals within the institution. If you are dealing with Parliament, we deal with Parliament. When you deal with the parliamentary committee, it's the committee, not individuals. So the intricacies or otherwise in relation to the individuals in that institution, we have no role in. As far as Leg of Writers is concerned, I must confess that these are some of the details and micromanagement issues I said that I don't do. Because procurement is squarely and completely on the hands of the procurement managers and procurement people who sit at KEMSA. And they are the ones who would be able to give that detail. But my point is, on the issue of Leg of Writers, I think that is a question that had been asked earlier. And I don't know who Rashid Issa is, and I have no interest personally in the institution, and I don't have the details of that particular procurement aspect. As I said, there are over 60 companies that relate one way or the other to KEMSA. And I don't have the details of the transactions that take place around each organization. However, it is something that I've taken interest in since you have raised it. On the issue of Honorable Kotuni, raised a very fundamental issue. And the question is, what is the money lost we are talking about? Let me explain that there is the money lost, as you coined it, is an operational loss based on the drop in prices. In other words, there is no money that is lost as in there is money that did not buy anything. There is no money that did not buy anything. All the money that was spent on buying PPEs, on buying equipment, on buying commodities, on buying ventilators, all those things are in the warehouses of KEMSA. There is no loss in as far as the purchase of quantities and commodities is concerned. The only loss that is envisaged is the one that I'm talking about, which is essentially an operational loss, as is going to be made by all other institutions in Kenya for the time being. So I want to clarify that issue very, very clearly, and to say what we are dealing with is operational losses because of the price drop, not a question of commodities that don't exist or air that was delivered at KEMSA. And all sorts of investigations, private and public, will show that what I'm saying is correct. And that is what all investigations we have carried out. And in any event, even in reference to what Honorable Kagwe was saying, there is an investigation going on at the moment, going to be in the next few days. And I'm sure some of those things will come out very clearly. And the issue of a fake disease, I think you are right, and I personally spoke to Mheshimiwa Kuria yesterday, and I think he's the first one to tell you, this thing is real. This disease is here, and it is real, and it's killing people. It's killed over 500 people. And a lot of people may not have believed it before, but I think just about every Kenyan has been touched in some form, either directly or indirectly by this virus. And I think going forward, and we must also appreciate Honorable Kotuni through the chair, that it is still continuing. It is still here. And we have no way of telling whether it is going to do what it is doing currently in Germany, where it went down, they opened up, and suddenly, the deaths have started going up again. We don't know whether this is what is going to happen. So it is real, and it must continue. On the issue of suspension, the suspensions at KEMSA, first of all, were recommended by the EACC. They are the ones who recommended the suspension pending the investigations that they are currently going on. So I may not be able to enter into the details of that investigation. And I think it is good that it comes out at the proper time in the manner that it was brought. But the only thing to say is that usually when you are managing an institution, there are a number of issues that can be challenging. A, for example, if you go over budget of an item. B, just inefficiency. The issue of efficiency is also part of management rating. It is not just a question of being corrupt or not being corrupt. There is also the question of general efficiency in management, and that counts for a lot as well. So I really don't want to get to that if Mheshimiwa does not mind. I would like to wait. And on the question of the number of times I have visited KEMSA, and I read that in some publication. I saw some publication saying how I used to walk. I used to walk to KEMSA on very frequently. I don't know, with a brigadier or some general or something. Can I state for the record that I am actually feeling bad to say this, because it is something that I should not say, but I've just been so caught up with the management of COVID-19 that I have not personally ever been to KEMSA. Forget about working with a general or brigadier, or even my PS. I hear it is my PS and I who walk constantly. Mheshimiwa, read my lips through this through this mask. I have never been to Kemsa. So, in somebody's dream, you know, I appeared there somehow, but honestly, I must confess, I found it very strange for somebody to allude to the fact that I may have been there trying to do this or the other. And I honestly cannot say why anybody would propose such a thing. And in any event, I don't even know why one would say that, because it is my right and a responsibility for me to visit Kemsa. In fact, Mr. Chair, Madam Chair, on 2 occasions, I have let the chairman down. Because on one occasion, I was supposed to inaugurate the new members of the board, which I failed to do because, again, of emergencies that arose. On another occasion, I was supposed to be there so that we can go and inspect the warehouses. I have not been able to do that. So it is my job to go there and look around and inspect, like I do with all other sagas. But Kemsa, I just haven't been. As for the last issue that you raised, Honorable Kutuni, on the issue of something about on the issue of donor funding, the relationship we have with donor funding, we keep in touch with with the donors all the time. In the last 2 weeks only, I have been on virtual conferences with the Global Fund. I've been in meetings with the USAID, personally sitting with them, with the American ambassador, dealing with all those issues of donor funds. I have been on virtual meetings with the British High Commissioner, just to align them and tell them what we are doing. And yes, they have demanded that we make reforms, particularly at Kemsa. They have said for us to continue working with you, we need you to make reforms at Kemsa because we are just not operating efficiently enough. And we are determined, as a ministry, we are determined that these reforms will be put in place, not because they are being demanded by donors, but because they are necessary and is the right thing to do if we are going to be able to bring the cost of healthcare down. The institution of Kemsa is a crucial one in bringing the healthcare prices down, in ensuring that they buy things in bulk, operating from an economies of scale, and therefore bringing down the prices of medicines and prices of other commodities. One of the things I would like to inform the committee is that going forward, one of the things that's happened about Kemsa Capital is that the ministry has not really been much involved in as far as management of Kemsa Capital is concerned. And I think is an important part to say that no matter what the funds are within the institution, they must purchase things on the basis of need analysis from the country and counties, rather than simply operating on a free fall. That way, we can bring down the price of the cost of healthcare in the country. As far as and that inefficiency is what I'm talking about. As I said, the steps we have taken include the bringing in people to come and deal with analysis of the levels of inefficiency. We have been, USAID actually spent a lot of money to create reforms within Kemsa. And I'm ashamed to say that those reforms, I don't think were quite carried out at the time. We are talking about a couple of years, from 2018 or so. So I think that going forward, those reforms are things we are going to do. You heard yourself the president order that part of the very important issue that we have to deal with is the issue of transparency of tendering procedures in Kemsa. Because I can tell you that it's very skewed. It's very skewed. But the transparency we are talking about will also require, Madam Chair, support of this committee in legislation and indeed support of the House, of the entire Parliament, because of procurement procedures, which is what we are trying to deal with at Kemsa. Madam Chair, the procurement rules that exist in this country at the moment were made on the basis of paper procurement and paper trail. That is why, for example, you are supposed to give 21 days for something to happen. Now, if you look at the operations, similar operations in a place like Dubai, what takes us here 3 months, in Dubai it takes 7 days to 10 days, because it is all based on ICT. And therefore, a requirement that, for example, you must give 14 days before a response is given. When you are in the computer and it is live and interactive, that is a process that can take 2 days. When you are supposed to complain, there is no point of giving 21 days for 14 days for people to complain, because when you are interactive and live, you can complain on the same day at the same hour and say that you are not satisfied with something and it is responded to immediately. So we will need legislative support from the House going forward so that some of those requirements do not hamper the kind of reforms that we want to do in order for our procurement processes to be ICT based. On the matter to do with the expose, as you call it, you know, Madam Chair, there are some balances. I think it is very important for the way our constitution is structured, that Parliament oversights and continues to oversight, and we are happy when we are being oversighted by Parliament. I think it is also right, as members have said, Honorable Chek mentioned it, about the fact that we are supposed to also come here to respond to the issues that are raised by Parliament. But I think, Madam Chair, we also must remember that the media has also got a responsibility when it comes to some of these things. Madam Chair, when you consider the amount of time taken by the members of this committee, by ourselves, by the people who are sitting here, you know, analyzing this situation, when you look at that whole time, it is very important that that time be based on something that is factual, on something that is real. Because, as the Honorable Kutuni rightly pointed out, it is very easy to spoil people's names, to mess up with people's careers. Businesses that have been developed over 40, 50 years are put in like criminals for no reason. So I think facts, it is so important for us, Madam Chair, to come with facts. There is another aspect that I think I should also mention in this House, because in response to the same question, I think, Madam Chair, it is important to look at the structure of businesses in this country and to understand, for example, if it is a KEMSA, or in the same KEMSA that you have raised, 80% of the businesses that are done in KEMSA do not even relate to the people, most of the people that you represent. A majority of the people that you represent only probably have about 20% of the businesses in KEMSA. Why is this the case? What is the way forward? When we talk about local manufacturing and attracting our own people so that they are able to participate in the process of business accumulation, the reforms we are talking about, we include contract manufacturing, so that the manufacturing is done here in Kenya. And Madam Chair, let me just raise this flag as I conclude going forward. Please, when we start the local manufacturing, if an item is going to be 10 shillings more expensive than an imported item, please do not accuse the CS of buying an item that is more expensive than one that could have come from China. For a simple reason, that if you do the maths, you will find that there is taxes that were paid here, there were jobs that were created here. So when you do the cost-benefit analysis, the 10 shillings may seem high, but in real terms, you know, that money comes back to the government. So I want to plead with the committee, when we come with these legislative requests, to please support us and please support the local manufacturing sector, so that our people can also be the participants in supply of KEMSA. I submit.
Thank you, CS.
He left one, sorry to interrupt you, Chair, sorry.
Honorable Chakagwa.
He left one issue of the chairman of the Chamber of Commerce doesn't want to appear before us. I had asked about that comment.
I cleared that, Honorable Chakagwa. I said that my understanding is that the chair had said that he is coming.
While at it, Madam Chair, maybe if for whatever reason it is found that there is impropriety at KEMSA, Honorable CS, isn't it time that you send the entire board packing, the board members of KEMSA? other than just the CEO. They met together.
Honorable Jagogo, that's an additional question. So I'll hold it. CS, you can take some water. I want to give it to the PS because you're trying to be... Stop.
Are you with this committee?
I'm with you, but that was an additional question, and I already made a ruling that we'll still take more questions. The CS is not going anywhere. I think it's important he takes just some water, and I give it to the PS to do her submission. You can proceed.
Thank you very much, Chair and honorable members, and thank you for giving us the opportunity to air on some of the issues that have come out in a very controversial manner. Chair, we'll start with the background that we have provided here, and first, Chair, maybe perhaps to refer to your letter and the information that you sought from us. You wanted to know by the letter of 1st September the role of the Principal Secretary and the Cabinet Secretary.
And speak to the microphone, or you can shift if the microphone is not clear. Just hold the microphone up so that we can hear you properly.
All right. Is that better? Okay. So I remove the mask, maybe. It's so hot. Okay. Let's keep it. So, honorable members and the chair, through the chair, there are 3 questions that we are expected to respond to, and this is as communicated by the letter of 1st of September. Chair, let me begin by responding by giving a bit of background that in its oversight role to the Kenya Medical Supplies Authority, the National Assembly Department Committee of Health has commenced investigations into claims of alleged misappropriation of COVID-19 funds, irregular procurement process, and other related issues. And so it is in this regard, as I said earlier, that the committee, by their letter of 1st September, invited us to answer to the following questions. The first one is, as I said, the role of the Principal Secretary and Cabinet Secretary in the 758 million and 7.1 billion procurement, and as follows. On the 758 million, Chair and honorable members, which is part of the 1 billion, which was provided by the World Bank, the Ministry and the World Bank jointly agreed on the budget and the procurement plan based on priority areas in mitigating COVID-19. The Ministry subsequently formally requested KEMSA to undertake the procurement and delivery of commodities to national and county facilities. With respect to the 7.1 billion, the Ministry has no role at all in that procurement because these funds are related to the KEMSA capital funds. The role of the Cabinet Secretary in this matter was to provide policy direction for the bilateral support from the World Bank. And with respect to the Principal Secretary, the role is to, number 1, requisition the funding from the World Bank. Number 2, make requests to KEMSA to procure items on behalf of the Ministry based on the needs analysis and available resources. And there's an Annex 1, which I will come back to. And finally, based on the needs analysis, give the distribution instructions to KEMSA for the procured commodities that are funded through the Ministry of Health. Chair and honorable members, allow me to go to to turn to Annex 1, which is attached, so that, Chair, we can walk you through how we have managed and prosecuted the procurements as relates to the 758 million. Chair, on 18th of March, as you can see in the attachment, we gave instructions, or we requested KEMSA to undertake procurement of those following PPE items, N95 masks, and some laboratory sample transport collection consumable kits. And Chair, this was followed by specifications which were then later sent to KEMSA. On 19th of March, and again, Chair and honorable members, this is when we had the very, very first cases of COVID being reported in the country. On 19th of March, again, following a meeting that had been held with the laboratory team and the resource mobilization team of the National Task Force for Coronavirus, a decision was therefore made to procure commodities for COVID-19. And it was in this regard that in addition to the request we had sent in 18th, that we required to procure 6,000 laboratory test kits, which included the laboratory supplies and reagents. And the Chair and honorable members, that was provided for, again, as we instructed the KEMSA to procure. Again, on 23rd of March, the ministry again wrote to the CEO of KEMSA, and again refers to the National Emergency Response Committee on COVID-19, which had met on 21st of March, and where it was agreed that there was an urgent need for us to procure 30 ventilators to serve both the adult pediatrics and then also universal disposable tubing and accessories. And we also gave an estimated cost of what was, said to us would be the price. And so we also noted to them that this was needed for purposes of the intensive care unit services in response to the emergency. And in this respect, we really asked them to procure urgently so that this can be distributed to the counties. Chair, following that request by the ministry running from 19th, 18th, and 23rd, I then sought to be given the status of the procurement at KEMSA. And Chair, I must note that there was quite a bit of communication, and eventually the Chair was able to get us to receive this information. And so, Chair, if you note in the communication that is by the email from KEMSA, they are submitting to us, as you can see from their email of Thursday, 2nd of April, that the total, the emergency procurement status as of 2nd of April of 2020, and also their planned procurement of the ventilators and the planned procurement of the lab commodities. And Chair, if you turn to the next page, you will see that the communication that came through, actually it was 2nd and on 1st, and this case, in fact, the 1st of April, communication had already been sent to us. And Chair, as I submit this email communication, I want to confirm to you that the World Bank considers emails as official communication, and I also sought guidance from the the Auditor General's office, and I'm told that comfortably that emails are also official communication documents. So you can see that as of 1st of April, the KEMSA had already undertaken a procurement of 2.1 billion worth of commodities. And out of that, they were indicating that they have received 149,000 worth of that. So, Chair, if you go further, you will notice that they gave me a detailed report on what they had already procured as of 2nd of April and 1st of April. Chair, in this document, which is listed and has got very small print, there is the first column there which talks about the numbers, of course, how they are arranged. The second column talks about the item description. So these are the items that the ministry had requested to be procured. They also had the unit of measure, whether this was by pairs or by pieces or by any other unit that was relevant to the respective items. Further, they also indicated to me the suppliers. You can see there, they have listed all the suppliers who been contracted to procure these goods. And Chair, as you move along, you notice that the unit prices are also provided, and the quantity against each company. And also you see the total cost, Chair, which if you follow through to the bottom, actually comes to 2.1 billion worth of goods. So, Chair, it's important for you to note that this document came from KEMSA communicating the status as of 1st of April. So when I received this, and Chair, I would want to assure you that I had had several communications trying to get this information, I called for a meeting between KEMSA and us to just discuss about the World Bank procured items. And when we met, Chair and honorable members, I requested KEMSA to rationalize the budget because they had clearly gone way beyond what was expected to be spent. And again, you can see through the email communications that are shared between ourselves and KEMSA, and even KEMSA writing to me, because they write to me on I think this is let me just confirm. They write to me on the 7th of April, and the commercial director writes as follows: Dear Madam PS, I refer to the consultative meeting held at Afia House on 6th of April 2020 on the above captioned subject matter. As advised, we had to scale down the commitments to the budgetary limits guided, and I had given them the guide, and which is the 758. We shall be reviewing other previous instructions from your office on various procurement and seek guidance accordingly. So they also refer to the request that we had made. But if you also note on the same matter, the Director of Commercial Services attaches 2 documents, and in fact, to one of the officers in the ministry, and the document is attached there, Dr. Wangia, who is the project manager. He says now that they have attached the rationalized budgeted items. And you can see that, again, the emails are attached there for your appreciation. And then KEMSA goes ahead to basically attach the commodities that they had begun to procure up to the 600 and let me just refer very clearly, which is 758 million. So, Chair and honorable members, when they gave us these rationalized figures, and Chair, you can see all that KEMSA did was to reduce the quantities, but the presentation remains the same as the one that they had made on 1st and 2nd of April, which is the items description, the unit of measure, the supplier, the quantity ordered, the unit price, the total cost. So it's a complete replica of their submission of 1st of April, but only that this time they have rationalized it to fall within the budget that the ministry had set, and which really we had funds for. So my biggest concern was that we do not make commitments beyond what is not available, because again, that would be in contravention with the public procurement laws and the PFM Act. So, Chair, following the receipt of this letter, I then now wrote to the CEO of KEMSA on 15th of April, now confirming to them that we have various items that have been identified and approved by the bank for the procurement of KEMSA, and now I was communicating to him that we have approved procurement of goods worth 758 as outlined in the attached annex. And they will go further to say, disregard all the other requests made in relation to COVID as they have been captured under this approval. And Chair, why this was necessary, and honorable members, was because looking at what had been procured and what the ministry had asked for, actually the institution had gone way beyond the request. So at that point, it was just a question of capping them at 758 million so that we could be able to process that. And so, Chair, using the very document that they had submitted to me on the 7th of April, outlining the rationalized budget, I went ahead to give them the approval. And so, Chair, if you look at the attached document, which contains the details of the order, and which has been going around and claimed that the PS gave instruction, Chair, you can see that word for word, this is really a replica of the copy of the rationalized budget that came from KEMSA. So, Chair, this is to say very categorically that at no time did the ministry submit a list of suppliers from which KEMSA would buy. What the ministry did was to simply adopt the rationalized budget, because remember at that time we were in the middle of a crisis, but on the other hand, we had to ensure that we spent what we had available. Chair, going on further, just so that we understand the context at that time, on the 22nd of June, 2020, I received a letter from my colleague in the National Treasury. And my colleague makes reference, Chair, if you can read the letter dated 22nd June 2020, it's from the National Treasury. And it says that this is in reference to the letter of KEMSA dated 2nd June, seeking for budgetary support amounting to 5 billion to facilitate payment for the health products and technologies to cater for the distribution to public health facilities and other institutions providing COVID-19 related services. KEMSA has indicated that in consultation with stakeholders, it mobilized COVID-19 emergency supplies worth 5,140,946,000 with a view to mitigate potential supply shocks and far-reaching COVID-19 implications. However, we note that KEMSA has not provided information of whether the commitment was made without confirmation of availability of funds from the ministry. The above notwithstanding, it is noted that KEMSA has addressed this request directly to the National Treasury and Planning, therefore bypassing the Ministry of Health. KEMSA is advised that such requests should be channeled through the Accounting Officer, Ministry of Health. Further, since the National Treasury does not have any scope for additional funding, the Ministry is advised to use the resources available for COVID-19 in the year 2019-20 budget. So, Chair, you can see now here KEMSA is coming to the reality of overcommitting, and now they have committed up to 5 billion. And Chair, I want to also be very categorical to say that the ministry was not aware of, that such a commitment had been made. And perhaps that's why the letter had gone directly to the National Treasury and not through the ministry. So, Chair, you can see there the next letter is the letter that actually had originated from KEMSA to the CS of the National Treasury, seeking for finances to be able to meet this cost that they had incurred of 5.14 billion. And they all go on further in the attachment, Chair, to list the items that they had procured, all the way from KN95 face masks to the VTMs and all the other items that are listed there, totaling 5.14 billion. So, Chair and Honorable Members, when this letter was received at the Ministry, I then wrote back on 2nd of July to KEMSA, and I made reference to the letter that had come from the National Treasury on 22nd June 2020, and here we noted to KEMSA again that KEMSA had sought for budgetary support from the Treasury to facilitate the procurement of COVID-related items, while these funds had not actually been provided for the funds were not provided due to unavailability of any scope for additional funding. But we also went further to note to them that through their letter, our letter, the ministry's letter, we had only given them approval to buy items valued at 758.690 million. And we also noted to them that through the National Treasury letter, the one that I have, another one of May 13th, authority to undertake procurement of health products under Global Fund grants to support COVID-19 response in Kenya valued at 517. Again, this was money that the Global Fund had given directly to the National Treasury so that KEMSA would be able to procure items. And then we also, I go further to tell them, to remind them to observe the authorities provided in the COVID-19 related items unless otherwise advised. Because, Chair, in my earlier letter you have seen I've only given them concurrence on the 758 million. And I also raised the concern that has been raised by my colleague that communications going to the Treasury must go through the accounting officer of the Ministry of Health, which in this case had been bypassed. Chair, if you go on further, you will see that on 6th of August, I've attached a letter. 6th of August, KEMSA writes to the ministry, and it's a long letter, but Chair, the bottom line in this letter is KEMSA is seeking for us to give them resources totaling up to 2.9 billion. First, they start by saying, one, they wanted us to convert the UHC funds, which had been provided for purposes of UHC, and the balance at that time was 6.7. They wanted us to use this money for paying for the PPE. So that was their number one request. Their second request was to be given additional financial support to pay for 2.9 billion worth of commodities that had already been delivered and not paid for. Chair, I then responded to them by the letter of 11th of August 2020, making reference to their letter, and be it also noting to them that they are requesting for additional finances, and I am pointing out to them that we are advising that the funds for universal coverage should not be utilized in the payment for delivered COVID-19 emergency supplies. And we also noted to them that the ministry was not in a position to provide any additional funds at the moment to cater for the delivered supplies. However, we told them and encouraged them to seek their own internal mechanism to address the cash flow management issue, and therefore advised them to take the necessary action. So you can see now there's a real attempt to try and secure funds for commitments that had been made. The question here is whether the board had given the approval, but I can say certainly the Ministry of Health had not given any additional request other than the one that we had agreed with them for the 758. Chair, I've just attached this letter of 27th of August, which was a letter addressed to the acting CEO, and this really was a letter that was in response to the allegations that had been made. They had been made here in Parliament that indeed we had given. In fact, I say this office, which is the PSA's office, had given names of preferred companies to supply COVID-19. And Chair, in this letter, I am reminding them, number one, of the instructions that they had been given from the ministry, which they had not even responded to by that time. Further, I also reminded them of the meeting that we had on 6th of April, which was then meant to ensure that they do not go beyond the thresholds, but we recognized that KEMSA had proceeded to procure goods in quantities that were way beyond what had been requisitioned in the 3 communications that I had mentioned above. Also at this point, Chair, we are noting to them that they had already bought goods worth 2.1 billion as per their report of 1st of April 2020, and also, of which my request only had 149 million worth of goods, and that there was a balance of 2 billion, which they were yet to have paid for, but those were, the procurement that had exceeded the ceiling that they had been given. So we go on further in our letter to recall the meeting of 6th again, where I had asked that they reconcile what was requisitioned by the ministry vis-a-vis what KEMSA had procured, which was worth about 2.1 billion. And it was at this meeting, again I'm noting here, that KEMSA was asked to rationalize the budget in order to align it with what the ministry had been allocated for PPEs. And subsequently, via their email, they had scaled down the procurement to 758 million. And the budget submitted by themselves had details of the items procured, their quantities, the suppliers were also noted, as well as the overall cost of the consignment. So I go on further to tell them that whereas there was an impression that had been created that the ministry had given KEMSA the list of the suppliers, it is actually them, KEMSA, who had provided the details while submitting the rationalized budget, as mentioned above. And so again here I reiterate my concern on the matter because I was solely concerned about the budget and had no intention at all to manage or to direct the procurement process. So in the light of this, I asked them that if indeed they stand by the allegations that they were given the instructions by the ministry regarding which suppliers to procure from and at what prices, that they provide the letter that had been used to purport that my communication to them bore instructions as to where to source the items and the prices. And so for the avoidance of doubt, the only concern that we had as a ministry, was to ensure that the budget for the procurement was within the funds which were available for that purpose. And again, Chair, I had already referred you to an email that was written on 7th of April 2020 by Eliud Mureithi, who is the KEMSA Director of Commercial Services, and addressed to me, among others, confirming that the budget had been rationalized to be within the available resources. So I go further to tell them that they should note that it was after I had received the rationalized budget provided by themselves, which included the corresponding suppliers for each item, that I revised my earlier instructions to align the procurement to the budget rationalized by themselves, considering that the items were being procured on an emergency basis and the ministry needed to avail the funds to meet the cost of what had been procured under the instructions issued earlier on. So I urge them to trace and reflect on the sequence and flow of the relevant communication between the two offices and consequently put the record in the correct perspective in writing. So, Chair, I am awaiting their response, but certainly you can see the documents are attached here, and they make reference to the emails that I had noted to you earlier, where they are writing, recognizing that they had a meeting where they rationalized the budget to the 758 million. So, Chair, going back to the questions, because that one was in response to the question number 1. Now, the second question was about the status on UHC funds that have been transferred to KEMSA as at 1st September 2020. And Chair and Honorable Members, towards the realization of universal health coverage, amongst the key interventions was to ensure availability of affordable and quality medicines and medical supplies to all Kenyans across the country. Key policy documents were developed at the time to guide this intervention, and this included the revised Kenya Essential Medical List of 2019, the Kenya Essential Medicine Supplies List of 2020, and these documents detail the essential medicines and medical supplies that, 1, meet the priority health, 2, are safe, effective, affordable, that be always available with the healthcare system. So in the third quarter of 2019-2020, that is January to March 2020, the national government provided a conditional grant to counties and the referral hospitals through an intergovernment participatory agreement which spelled out the allocation of medical commodities to each county and to the national referral facilities as drawing rights at KEMSA. And to respond directly to the question, the status of disbursement to KEMSA for UHC-related medical supplies is cumulatively at 9.62 billion. That is money that was transferred to KEMSA for purchase of various medical commodities for UHC, and this is as follows. The first transfer was done in 11 March 2020, and Chair, you can see, and honorable members, a lot of this money came towards the end of the financial year, 2019-2020. Another tranche was transferred to KEMSA on 30th of April, totaling 1.1 billion, and as of 11th July 2020, another 2.6 billion was transferred, and on 11th July 2020, 1.8 billion had been transferred. So as of 1st September, 9.6 billion shillings had been transferred to KEMSA specifically for UHC. And this is why, Chair, even in my letter to KEMSA when they were asking that they use this money for COVID, my advice to them was no, because it already had been committed for very, very specific interventions on UHC, and turning to use those funds without any approval from the National Treasury would be tantamount to going against the PFM Act. So in respect to the third question, which was the status of the delivery and receipt of the COVID-19 related items, I would wish to state here that the Ministry of Health has not directly procured any COVID-19 related items, and all the procurements have been undertaken by KEMSA in line with its mandate. Chair and honorable members, in our earlier submissions to you, we provided all the details of the utilization of all the funds that have been sent to the ministry with regards to COVID. And we articulated beyond the 758 million, all the other resources for HR, etc., and clearly outlined how the funds have been spent so far. So, Chair and honorable members, I wish to submit, recognizing also that this invitation was equally extended to KEMSA, and so I'm sure that they will respond to aspects of the questions that are very relevant to them. For example, where they are on the UHC funds, the utilization levels, and other issues where they may be the custodians of the information, and to just align ourselves to your direction that they too appear and present their perspectives into it. So, honorable members and chair, I submit.
Thank you very much for your submission, PS. I think from where I sit, my first question is, why were you communicating with the Eliud Muredi and not the CEO? I've seen a lot of communication is between you and Eliud Muredi. And at whose direction or authority did KEMSA procure above the budget? You've clearly said you told them not to spend even the UHC money. And maybe the question that will come, so what's the real expenditure on COVID with KEMSA vis-a-vis what KEMSA was supposed to spend on other items, including the UHC? I'll give it to the members. I've seen something written in the letter by Manjari that there was with consultation with stakeholders. Did you find out who are these stakeholders? It's okay, you will answer them. So, and do we have any more money, well, be it donor money, that is pending, that the ministry has authority to for expenditure, either through donor or from the ministry for COVID, or are the COVID coffers in the ministry dry? And all this time, I was just thinking by myself, where was the board? You can see communication between yourself, CEO, the commercial director, treasury. All this time, did you either call the board or where were they? And maybe finally the UHC money I've seen, it was given between March and July, just within 3 months. It's a lot of money, 9 billion. Have you found out whether it's still in the accounts or has KEMSA used that money? And why did it take too long, towards the tail of the year? That's when the UHC money was given to KEMSA. I want to open it to members, and can see Honorable Koros, Dr. Dahil Duale, Professor and Owino, or Captain Rueda. You'll also take the opportunity to introduce yourself as you ask your question, including Honorable Duale. Karibu. Yes, proceed.
Thank you, Chair. Thank you, Chair. So I want to ask something the PS, both the PS and the CS. What is the relationship between your two offices in terms of communication, consultations, and also, because I'm asking this because I've seen there have been a lot of communication between the CS office and KEMSA. But what I want to ask the PS, did you use to consult the CS in all these communications? This also will arrive also to another question. Pana CS, we saw after this issue of COVID problem, I mean the KEMSA problem when it was in public domain, we saw some changes, some restructuring in the Ministry of Health. We saw the president, he did some reshuffles, and then later on he halted the reshuffles. Bwana CS, what was your role in this? Were you the one who was advising the president for cover-up, or what was the issue? Madam PS, I wish this is the only court you have. It is like, after all, these COVID millionaires will still sacrifice you. You saw what had happened. If I were you, you better tell this court, this house, the truth. You could be knowing a lot of things. Madam PS, among these COVID billionaires, who did approach you or reach you for tender interference or tender favoring. Can you kindly tell us, because we are seeing there is something between your office and the office of the CS. There's something, and somebody will be sacrificed. We want to know if there were clearly consultation between your office and the office of the CS. And if it was there, if it means one will be sacrificed, supposed to be both of you to go. We want to know clearly if there was clearly communication and consultation.
Your point is clear.
Chair, I think, yeah.
Honorable Koros, thank you very much. Professor, was it Professor number 2, or was it? I can come to Dr. Dahil.
Okay, thank you, Chair. First of all, let me introduce myself, Dr. Mohammed Dahil Duale, member of the Health Committee and also member of Parliament for the Dab constituency.
And I would request you put up your mask as you do your submission. Thank you.
Honorable Minister, first of all, I want to inform everybody that I was a victim of COVID. And I was in hospital for 42 days. Thank you so much. That 5 days I was on oxygen, and 7 days I was in ICU. So COVID is really real. And fortunately, my bill was paid by the Parliamentary Service Commission, but I don't know how many Kenyans will have the same privilege, because close to 4 million shillings was paid by the insurance which covers our service. So let me just go straight to the question. I thank the PS for the presentation. Madam PS, one thing I note in the presentation is that KEMSA was procuring things which they did not have money, according to the correspondence. Because the first thing they did was to write directly to Treasury requesting for funds, and the PS Treasury referred the matter back to you. And the 2-point-something billion, first of all, we would like to know, did KEMSA actually pay for that procurement, and who requested for them to procure those supplies? I also know that in the letter, there is information that they said they had instructions about who to give and so on. Now that information, of course, you had asked them to provide. But from your own, maybe there are some documentation which are not available. Do you know, were there other forces from elsewhere who are trying to force those people, and you might have that information, because it will be very important to know. Finally, to the CS, Bwana Waziri, I do know that you have talked about reform for KEMSA. We also have serious issues with the NHIF. I happen to have been here the last parliament and now here, and we have been talking about all this for all this time. You are probably the third minister who we are dealing with, maybe perhaps fourth minister, and it has been left at that point. Do you think that it will be possible for you to achieve a reform of those institutions in your tenure, or in the next 2 years, whatever time, so that we don't end up with this kind of issue? Because I think these are really related to reforms of these institutions, both of them, which we have serious issues of malpractice. Thank you so much.
Honorable Joyce, I'll come to you.
Thank you, Chair. I want to appreciate the PS for the elaborate submission she has made. And
I'll also remind you to put up your mask.
It's okay, Chair. For the elaborate submission she has made, and the flow, I think, is so clear to me, including the annexes. I've been able to follow them clearly. What surprises me, Honorable Chair, is the way KEMSA misled this committee, because that is the information that came to the committee, and it's the information that is carried out there in the media and in the public, that instructions were given as to who should be given tenders and at how much. It's now clear from the presentation made that it's KEMSA themselves that really initiated the communication on the proposal and the list of maybe pre-qualified suppliers that they had. And they again gave the rationalized budget as advised, and this is what prompted the ministry. That's to my understanding. And then the other thing that surprises me is the way KEMSA bypasses the mother ministry in asking such a huge amount of money. 5 billion is no small money from Treasury without the ministry knowing. One of the issues that is going out there is a company called Kilik that is associated with senior politicians in this country. I've tried to look at the list given by KEMSA, although the prints are small, and we are told the devil is in the details, but I haven't seen that company. Maybe the PS could also shed some light if she's in the know of what really that refers to. Thank you, Chair.
Thank you, Professor Mohammed Margaret.
Thank you very much, Chair. Thank you very much, Madam PS, for actually going through the detailed queries and questions and matters that we have raised earlier and you've responded to. But objectively speaking, investigations will go so far and painful. That must be known by Kenyans, and that must be known by the culprits, and that must be known by all public officers. And therefore, it is far worse than the messy mess that we have seen over the messy mess saga that we have seen over the years. It will be a relentlessly painful one on this matter, I swear. We are not yet out of the woods as per the COVID pandemic. But if you look at Table 1, which shows a cumulative expenditure of 9.6 billion already spent on UHC between March 11th to July 11th, 2020, it becomes obvious that we need to ask questions on this. That was about UHC. But can you tell us how much of the 9.6 billion was expended on the COVID emergency, other than the normal expenditure that you have authorized for UHC, budgeted, that is? Can you tell us what more funds are being expended and how much? That is under the COVID-19, under the UHC. Anything related to COVID-19, if there is any. Because the cartels are still living. The result of the cover-up of COVID-19, looting by the living cartels still exists. So we must be treading the two thin fine lines, the UHC and the COVID-19. It might be unfortunate that Kenyans will know that we are not going to focus on COVID-19 only. We will focus on UHC. Let Kenyans know that we will not allow any cover-up by any cartels or anybody else out there. This is a very objective question. PS, tell us, you've told us that KEMSA is a different entity from the Ministry of Health. To some extent, you did. PS, tell us who regulates KEMSA. Is it the Ministry of Tourism or the Ministry of Health? And as the accounting officer yourself, the Ministry of Health should definitely oversight KEMSA, I believe. And I will refer you with knowledge here. Gazette, Kenya Gazette, that is the 23rd June 2017 Supplement Act. Reads, PS, can I bring to your attention, for the purpose of Section 15 1B, the cabinet secretary. Of course, you're not, but you are the accounting that, and the cabinet secretary also involved in this, shall form directorates to deal with the following matters: medical services, nursing, pharmaceutical services, public health, and administrative services. But that's not where I'm heading. I'm heading to B. That was A. B says, notwithstanding paragraph A, form other directorates based on policy priorities areas in consultation with the Director General. I remain guided, but does it mean that KEMSA was actually established under that clause? Further, can I read to you, Madam PS? Read the KEMSA Act, October 31st, 2016, which formed KEMSA. That is KEMSA Act 2013. That must be read, and that must be explained well to us. The boundaries between KEMSA and the Ministry of Health. There are many Kenyans who are laymen and women who may not understand this, but we must read the law through the fine lines. Chair, I want to stop here, but I want to say something. You said that MOH has not directly procured any COVID-19 related items. KEMSA is a saga under MOH, and you are the accounting officer for Ministry of Health. Does this mean hands off the wheel and we are left to ride on the highway, or Kenyans are left to ride on the highway? Who takes responsibility for what? It is obviously this comes under the stewardship of yourself, of your office. And it is important that Kenyans are aware quite clearly that despite the thin lines, people should take responsibility for accounting on the institutions that come under them. I will finalize, Chair. Treasury referred KEMSA to the MOH, especially directly to you as the accounting officer, meaning you're directly mandated. If you look at the letter dated 11th of August, 2020, that you've written to KEMSA, CEO KEMSA, which you said that in this regard, we wish to advise that funds for universal health coverage should not be utilized in payment for delivered COVID-19 emergencies, etc. Definitely, that brings me to a point that it becomes obvious to my mind and to my attention that obviously this letter was dated on the 11th of August, yet the agreement on procurement between the ministry and KEMSA should have started earlier, around March, I believe, or so. Why should a letter go after 6 months or so? I rest my case, but before I do that, Chair, the National Task Force for COVID-19 must be called, and they must come and tell us more about international donations, about the services that were done, and who was responsible for what. I appeal to the committee to call the National Task Force for COVID-19, because this will be a very painful journey for everybody on behalf of the poor Kenyans who have died because of COVID-19 and who continue to suffer because of COVID-19. Thank you, Chair.
Thank you. I'll go to Captain Rueda, then I'll come to you, Honorable Wino. I can see Senior, I can see your hand. Allow me to give you at the tail end. Is that okay? I know you have been sitting for long, but because you're a friend of the committee, let me give Captain Owino, then I'll come to you, Senior.
Asante, Chairman. Kwa majina wanaitwa Captain Rueda Mohamed, County MP Lamu. Mwanzo ningependa kuomba msamaha, nimekuja kuchelewa kwa kwa sababu nilitoka Kiunga jana, nilikuwa safarini ndio nimefika. Mimi nataka mwanzo kumpongeza katibu mkuu kwa wasilishaji wake mzuri. Ukiona tunauliza maswali, tunauliza kwa uchungu mwingi, kwa sababu kama hujaambukizwa na COVID-19 basi umeathirika na COVID-19. Hata kabla haijakuja Kenya, ilipoanza tu China, Lamu wiki hiyo hiyo wale lobster walitoka kwa kilo moja ni 6,000 ikawa 600. Kwa hivyo katibu mkuu alikuwa anauliza hizi barua, sijui kama mna system ya kuonyesha, manake hizi barua za zingine zilizoandikwa kutoka kwa KEMSA na katibu mkuu mwenzako wa Treasury, zote zimeonyesha kwamba kuna ile muhuri wa received. Hizi zingine zako zote ziko hapa, lakini hazionyeshi kwamba ulizituma kweli siku hiyo au ni zimeandikwa baada kutuletea tu hapa. Swali langu ni hilo tu, asante.
Owino.
Thank you, Chair. First of all, let me thank God for Dr. Dahir, who has gone through this experience and is here with us. Chair, this disease is true. In my constituency, we've just lost a very prominent person in 3 days because of the complications. It's no longer restricted to the lungs. It spread fast to the heart muscles. And people now drop and die without proper diagnosis. So that we are talking of a disaster here. But having said that, let me thank the PS. It couldn't have been more clearer than this, and that is why the meetings like this is very important, so that Kenyans can get the truth, the facts as they are. It appears to me, in all this, you are sorting flies, but if, and I read it first, if the board was doing its work, then there will be no jumping to the Treasury, there will be no jumping here and there, because it appears to me, Chair, we are kind of dealing with a run-amok child here, who does things and then the ministry say, no, you can't do that. So what we are trying to do, CS, is, and it came from you and I'm happy, we are looking on how we can plug off the lacuna, either whether it is in the regulations and policies or in the State Corporation Act, that can reform this. And remember, the governors are also crying, because it is here that we fought. It was a heated debate that we make KEMSA a one-stop shop for all medical supplies for institutions of government. And now the the governors are on their arms. We may have to relook even the amendment itself. And the other day, Chair, you can remember, I did ask whether KEMSA has still the capacity. We talk of capacity of HR, how they run and all this, to continue to be main supplier. Remember, it evolved from medical stores earlier days, and that is what it used to do to the government. And now they have incorporated the business model, which could be also inhabiting greed and attitude of doing business more than the public good. So all this we have to wrestle with. P.S. I want to show you, maybe you don't have this document, but I'm just trying to say, when the ministry sets policy or regulations, is it followed with? There's a document here which came from your office, and it's an old document. I respect authority to incur expenditure. Having worked with the government for a long time, I know it should be respected the way it is. So I read it for you, but you may not have it, but you will reflect on it. Number one, it was written on 16th of June about the 1.5 billion, which this House.
Why is that document originated
it was in the
from?
KEMSA.
Or from the submission of KEMSA?
Yeah, it was the KEMSA. That's why I'm saying you
Okay,
have
well noted. And if you'd be able to refer, might be for the purposes of record, if it's an attachment 1B or annex. But if you don't have the details, you can still proceed. But I needed to know the document.
Yeah, I know she don't have it, but I just bring it to that. The point I want to make here is that it was 1.5 billion which this House approved because we believe that testing is key to know how aggressive this virus is moving around. Now, in the AIE, which you wrote and was prepared by Samson Ogalo, you said clearly that this being funds for procurement of test kits and reagents, which we approved for in this House to be done. Now, when it comes to implementation by KEMSA, they have added something which you can tell us whether was incorporated in that or not. They have 6 items. The 5 of them are testing kits. That one I have no problem. But number 4, gloves, medium size, 100 packets, 1 million. See, what I want to bring to your attention now is the disconnect. You give an authority and it is implemented the other way. That is why we are talking about reforms. Is it enough to give that, and when it is not done, what happens? Because if you ask me, gloves is not a test kit or a reagent. If it were to be included, then the PS would have also included in the authority to incur. And lastly, in that line, it says clearly how this is come. You will be. This is in the. You will be held personally responsible if you incur expenditure without proper authority or excess of the amount cited. So it's a crime already if you do that according to the AIE. So CS and PS, what I'm trying to say is that we need to look where there's a problem. This is not just witch hunting, but to make this institution better, and also to make you sleep. I know you guys are not sleeping because you try to kill fires here and there, and it's quite a lot of work. And we look at you on the COVID as well to give us what is going on. So lastly, I just want to say, if there is something you are seeing as a ministry that is making your work difficult with this agency, I think this is the time to pick them so that we can pick them up. There are also others which are seen in the State Corporation Act, which we will look into as a committee, and if possible, amend them. Otherwise, thank you for good job, PS.
Thank you.
Clarifying. Thank you.
Thank you. And I want to confirm for purpose of record on that attachment of KEMSA, it was Appendix 1A and 1B. Senior, Honorable Jimmy Angweni.
Yeah. Thank you, Madam Chair, for giving me a chance as a friend to ask 1 or 2 questions. One. All the PS tell us whether when KEMSA made a request from Treasury for additional funding, was the board involved? Was the board of KEMSA approved that request? 2, since it was communicated to the ministry that this KEMSA is trying to get funds through outside the system, outside the ministry, to make more messes, why didn't you get rid of them immediately? You didn't have to wait for ESCC or DCI to come and to ask them to vacate positions so further investigation can be done. And finally, I've seen that your tests have been reducing over the period in the last 1 or 2 weeks. Is it because you don't have testing kits, or is it because you have exhausted the people you want to test? Thank you.
Thank you. Yes, the CS and PS is your chance to
Thank you very
respond.
much. Asante sana. Let me,
and so that we don't lose people. CS, you know you are a politician like us, so would like we summarize so that we don't lose the
I will
numbers.
summarize very quickly,
Thank you.
Madam Chair. I actually note that it is going on to 6 o'clock. I will try very quickly. The first thing, I think Honorable Koros raised the matter of the relationship and whether the PS and the CS communicate in these things. The practical working environment, in a proper working environment where there is cooperation, is that the PS and the CS are continuously on all matters engaged and consulting perpetually. You can talk 3-4 times in a day. You know, it is a continuous engagement because this is the epicenter of the management of the ministry. So the level and quantity of communication depends on the environment, the circumstances that you are engaged in at the moment. Sometimes maybe you don't talk, maybe for a day, maybe the next day you're in a meeting the whole day together, as you can see what is happening here today. So I just wanted to clarify that for you, that it is continuous engagement. And generally speaking, if there is an issue of importance, the CS will obviously get involved. For example, when on the last matter that you are raising, on the matter of people wanting the direct communication between, KEMSA and the Treasury telling us, obviously we must consult. And on the basis of such a consultation, I will then tell the PS, cancel those things, all of them, which is exactly what we did. When those kind of things arose and we don't have clarity on them, we say cancel, we are not interested, we don't want to know, cancel them completely. And the Honorable Angwenyi, on that issue, or when you cancel it, then why not fire people immediately? I think that as you noticed, if you look at the timings between when all those things were happening and today, quite a bit has happened. And one of the reasons why one invites people like the EACC is actually to build credibility and authenticate what is happening. Otherwise, what happens is that you then get accused of victimizing individuals, you get accused of all sorts of mismanagement yourself. When you're trying to build some efficacy between the decisions that you are making. On the matter that, first and foremost, I also want, where is Dwale? He's gone. I also wanted to thank God for my friend Dwale, because I didn't know that he was in such a state, and I'm very happy, and I'm so happy to hear that you have recovered. The last time we spoke, you are okay, so I didn't know where you disappeared to, but God is kind and God is good that you are here with us today. It is because of His mercy and blessings, and we thank Him. But on the issues that we have raised, on the matters to do with NHIF, on matters to do with restructuring, general restructuring of health, let me put it this way, Mheshimiwa, is that we are as determined as can be. We are completely determined. And the part of the fights that we are engaged in relate to the idea that these things must be reformed. Because if we don't reform them, then we might as well go home. We are wasting time. And I'm glad to report to you that if there is one institution which I can see going the right direction, it is the NHIF direction. But I'm also happy, and I thank Parliament, because the support of Parliament, you see, let's not forget how insurance works. This is an insurance company. Insurance works on the basis of probability of sickness of one individual. So the more people we have insured in NHIF, the cheaper it will become, and the greater our ability to cover everybody in the country. Because UHC, which Honorable Sheikh is talking about, UHC, can only work if NHIF is working. Otherwise, it will be abused in a manner that you don't believe. So we have to introduce serious reforms. In the next couple of weeks, we are going to introduce biometric recognition of persons who are going to use NHIF. The reason being, then you can build data that can help you make decisions going ahead and that can reform the institution. But I can tell you that there's a lot of work currently going on in NHIF to restructure that particular health institution. Honorable Owino, I could not agree more, and I think the same theme keeps coming back. The issue of reforms at the NHIF. It has been requested by donors, it's been requested by Parliament, and I can confirm, Bwana Owino, honorable members, that this is something that we are working on. I just ask for a bit of patience as we do it, so that we do it also in such a manner that you don't do it and then you take 2 steps forward and you take 3 steps backwards. It's important for us to do it and do it holistically in an informed and structured manner. It's a management issue. And as for the governors, I think one of the reforms that is likely to come in NHIF, in KEMSA, is that this monopoly institution, the monopolization of every purchase, I think that needs to be reformed. And I have read the Act, I know what the Act says, but there are some things that do not have to be performed at KEMSA, that can be performed even at the county levels, provided that the oversight, even at the county levels, is just as good. And the directions that we give as a ministry include pricing, because on the other hand, you don't want to jump from the frying pan and then you go into the fire. But I agree with you completely. We have to reform it. The role of the board, I think that Honorable Owino had spelled out the board role very, very effectively in terms of CAP 446 and the other legislation items that you raised yourself regarding how we should relate. In terms of budget approvals are by the ministry. The running of the institution is by the board, and the board overlooks the management, what the management is doing on a day-to-day basis. But we must remember that the board chair is not an executive member of management. They are not executive members. If you look at the board, the Act itself, the board chair is a non-executive chairman, and that it spells out very clearly. So it is guidance, is provision of guidance, provisions of decisions, so that they can they make those decisions collectively. Is running the institution, but is not in executive terms. It is in collective advisory terms. Madam Chair, on the matter regarding the decisions and the relationship between ourselves and specifically KEMSA, I think I've explained that, and the decision and the reasons why there was constant communication, written communication between the PS and the institution is because, as you rightly said, the PS is the accounting officer and has got to be careful, and we have to watch out on what is happening. And if you read the documents that you have